the student list, please verify your name and your email address. Make sure there's no typos in there. If everything is okay, write okay in this square. If you need to change anything, like the spelling of your name or your email address, put a line through it and write the corrected version in that square. Okay? Okay, and we're live. All right. Good morning. Can everybody see the screen? This is where I do all of my audio or my visual aids for what I'm teaching. So most of the time you're going to be focused on me, but a lot of very important content is going to be on this screen. This screen, what you see on the screen, is what you see virtually. Okay. So welcome to everybody that is joining us virtually. We welcome you to our new class session. This class will meet on Mondays and Wednesdays from 9 a.m. until 1 p.m. for 4 weeks. Good morning. If you want to find your t-shirt on the front table that has your name on it, and then you can have a seat anywhere where there's books. All right, so this is our class schedule, Mondays and Wednesdays from 9 a.m. to 1 p.m. for 4 weeks. If you cannot attend live in the classroom for whatever reason, you can always attend virtually. The virtual live stream is found on our YouTube channel. That's the best place to go for it because you can ask questions in YouTube. But you can also find it on our flcnatraining.com. That's the site you were on to register for this class. It's streamed right there, but you can't really ask questions. If you click on that stream, it should take you over to YouTube where you can ask questions. We also live stream this to our various social media platforms. So if you find us on Facebook or Instagram, you can watch live there as well. So we're in a lot of different places. And of course, the replays are always available for you to watch after class as well to review the class information. I'm going to cover a lot of content. I've taken all the notes for you. You don't even have to take notes. All you have to do is stay reasonably awake. Okay. And we'll make sure that you learn what you need to learn. My goal is for you to pass the exam on the first try. That's probably your goal too. To do that, we're going to build on content that we cover in sequence. So that means we're going to learn some things today that we're going to build on Wednesday. And then next week, we're going to build on that knowledge. And as we progress through the program in a very sequential, organized manner, you're going to be able to apply these principles to various skills. Okay? Sound good? First class is the most important class. This is where we're going to build our foundation. Everything that comes from here is going to be built on what you learned today. So if you're at all confused at the end of class today, you need to come let me know and I'll help you through it. Because if you don't get today, what comes next is going to be a little bit harder for you to learn. Okay? Sound good? Now we got a lot of things to help you along with this journey. We've got some after class wrap-up worksheets that you're going to get at the end of every single class that provides a really quick review of everything that we learned in that class. Now, if you keep all 8, because there's 8 class sessions, if you keep all 8 of those, if you fill them out when we do the class, at the end of the class, and you keep all 8 together, that becomes a review packet when you're testing. Okay? It's a great review. And I've had some students contact me recently and say that that review packet was all they needed right before testing. So it just kind of reviews everything that we go over in a really quick and easy way. So when we hand out those review sheets, fill them out that class while it's still fresh in your mind, but make sure you keep them in a safe place. You can always access those review sheets in the metal organizer there by the door. And the review sheets are there for you. So if you miss a class and you're missing a review sheet, just grab it on your way out. Okay. All right. You also will get some wrap-up emails sent after class. So this is only for my my physical students. So those of you that are in this room, virtual people don't get these. These after class wrap up emails are going to, again, they're going to kind of review everything that we went through in class, but not, it's going to do it through links. So you'll get your link to this replay. You'll get your link to the videos that we're watching in class, and you'll kind of get next steps as well in those after class wrap up emails. Did anybody get any emails from me? Yeah, everybody got, okay. You need to open, if you got an email but didn't open it, you need to open it because that trains your email provider that we're okay. If you don't open those emails, your email provider like Yahoo or Gmail will say, oh, you don't care about this, and they'll send us to spam. If you did not get our emails, look in your spam. We're probably there. And you also have enrollment in the free enrollment in the online course. So that online course is going to take what you're learning in class and help you put it into practice. It's interactive. We're going to see how it's interactive in just a little bit toward the end of class today. But that online course, all of you guys have been enrolled. You probably got an email that says you were enrolled. And it's going to be the same username and password that you set up when we registered for class, okay, on that same site. There's over 100 lessons in there, and they're short lessons, and I've made them fun for you, but it's going to help you kind of gain a deeper understanding of the topics that we're covering in class. So it kind of goes with the program. You don't have to do it. The online program is completely optional. Some people will do the lessons while we're in class. Other people wait until they graduate and do all of the lessons before testing as a review. Either way is fine. Some people never go into the online program. I think that's a mistake because the online program really does help. You want the best chance of success. Okay. Lots of tools for you. And of course, my name is, I forget this part. My name is Patricia Laramie. I'm your instructor. I'm an RN. I have been doing CNA training now for 20 years. I've written the book that we're going to use in class. It's used by schools all over the country. We are the third most popular CNA training manual in the country. All of my videos are going to be used to train you on skills training, but they're also used, you can find them on my YouTube channel. They're used in lots of other schools as well. Again, I am the subject matter expert on prometric testing. So I know what the test requires, and I'm going to make sure that by the end of the course, you do too. Okay. We're actually the #1 channel for CNA training on YouTube. We've got 155,000? Yeah, 155,000 subscribers and 50 million views. So we're big. I know we don't look it. We're in teeny tiny Spring Hill. It's kind of hard to believe. Okay, you've got some books in front of you. Don't worry about it. We're not going to get into the books right now. That's going to be in about an hour and a half, but I just want you to know that you do have some books. This one is the one that you're going to keep. This is the one you can write in, the one with the spiral binding. This is yours forever and always. This one is only for homework, and we're going to get into that in just a little while. I'll teach you how to use your books and your syllabus and all of that. But we're going to jump right in with our first topic. And I told you that I have already done the notes for you, and that's why I need you to understand which book to find them in. So this book is where we're going to find the notes. As I'm teaching, you're going to see pages like this show up on the screen. It always gives you the page number. So right now in your spiral book, the one that red, white, and blue that you can see up there, I want you to turn to page 17. Those of you that are joining us virtually, if you have the book, go ahead and turn to page 17 as well. So this is the first topic we're going to cover, skill rules. When you're looking at this page, you can see the principle outlined here. You can see the skills that this principle applies to. So skill rules is going to apply to every skill we're going to learn. Down here, it shows you that I have a video for this available on my website. We're actually going to watch it in class as well. And we're going to talk about this in just a minute, but this is what we call a principle. You can see that up here. Now, when I first started teaching, I didn't always teach like this. So 20 years ago, I taught like most other instructors do, and I just showed you 21 skills. There was no rhyme or reason to it. I just kind of threw the skills at you, and here you go. But my students didn't do all that well at the time because it's hard to remember all of the steps for 21 skills. I mean, that's a whole lot of steps. And if there's no real connection between them, you're just learning skills to pass a test. Now, you might get lucky and pass a test, and that's great, but that's not going to do you any good when you're out there having to work on real live humans. Now it's real world versus the test. And if those two things don't go together, what's the point of class? Class is not to teach you how to pass a test. Class is to teach you how to work on patients and to teach you well enough that you can pass the test to be able to work on patients. They shouldn't ever be two different things. Does that make sense? Okay. So as I started to get deeper into teaching and I started to figure all this out, I realized that, well, wait a minute. These checklists that are public, the checklists that you're going to be graded with are public. These checklists all seem to have like the same steps on them. So why don't I group those together? We learn those steps and then apply them to certain skills. And that's how the principles were born. Now you can see all of these principles on the back wall. There's 11 of them. They're nice and colorful. You thought that they were just decoration. They're not. We are going to learn everything on that back wall by next week. Now, you're not going to go home and memorize. This is not flashcards. This is not, repetition. This is learning. We need to know not just what it says, but the why behind each one of those. If you learn that, then it becomes important to you. And it makes sure that when you're out there working on the real people, that you remember these principles. And it will help improve your practice overall. Sound good? Okay. So the first principle that we have to learn is where everything starts, skill rules. We're going to watch a video now that's going to go over this. It is my video, it is my voice, but it's kind of an animated type of video. And the notes for that are here on page 18. So you don't have to take notes. You'll also see on page 19 at the very bottom of the second column is a gray box. That gray box has review questions. So this is a workbook style book. It's designed to get you involved in the learning. So sometime in the next couple of days, you probably want to read these questions and see if you can answer them. Okay, good. So the notes for the video are going to be located on page 18. You can see up here, you've got that little video clapboard. That tells you the name of the video that these notes are from. Good? Questions? All right. The video is also going to talk to you about a topic called activities of daily living. And again, I don't want you to have to make a whole bunch of notes. I've done this for you. So the notes for that, when the video talks about activities of daily living, will be on page 89, just so that you know where to find it later. Okay, good. All right, Jacob, can you play the care plan and the CNA for me? The care plan and the CNA, why it's always about the care plan. A presentation brought to you by foryourcna.com.
Nope.
Thank you for joining For Your CNA's online.
It is outputting in the stream.
Okay, give us just a moment.
Like just resetting my HDMI here, maybe the sound. Maybe the cable. Let's try this once again. Oh, see.
CNA test prep.
Please give us a moment.
We will be preparing you for both the written and skills portion of the exam. This course contains videos, interactive lessons, activities, testing care plans, test registration instructions, practice questions, and much more. This program goes way beyond our skills videos available on YouTube. But in order to pass the test, there is one single principle that you must understand: the importance of the care plan. Without this key, learning the skills is meaningless. You might be able to mimic what I do in the skills later, but chances are you will fail the test because you didn't follow the care plan. So this course will teach you the skills, but you must first learn how those skills need to be done. So come on inside and I'll explain to you how the care plan works and why it is so important to the test. We are sure that you will become great CNAs, and you will provide excellent care for our residents. But before you get started, let's review some basics. Does anyone know what the initials CNA stand for?
Certified Nursing Assistant?
That's exactly right, April. A nursing assistant is there to assist the nurse. You will be receiving all of your instructions from the nurse and must follow their directions. This will probably include taking vital signs and assisting with personal care tasks. But you may also be asked to assist with other nursing procedures as well. It is important to only do the things that you have been trained to do. If you aren't sure how to do something, ask someone for help. It's okay to not know everything. But please, don't try to do something that you aren't familiar with. It might harm the patient. In this online CNA test prep program, we're going to show you how to do all tested skills. But that is only the beginning of your education. You will learn way more on the job because every patient is different and will have a different way that those skills need to be done. And that's where the care plan comes in. As a CNA, you will be expected to assist our patients with many routine tasks. Generally speaking, CNAs help patients with things that they can no longer do for themselves. Things like sleeping, toileting, grooming, bathing, dressing, eating, socializing, and activities. Together, these are called the Activities of Daily Living, or ADLs. These are things that everyone does every day for a healthy life. But not all patients will be able to do these things for themselves because of illness or injury. Sometimes people are too weak to go to the bathroom on their own or feed themselves. And that's where you come in. If a patient needs help with any of these tasks, you will be there to help them. But not all patients will need help with all tasks. This is Henry. Henry had a stroke and has right-sided paralysis. And this is Martha. She had a left hip replacement. This is Bob. He has had a recent leg amputation. And Annie has dementia. And they will all require different care. Some patients will need help brushing their teeth, but others will do that themselves. As a CNA, we will help the patients do the things that they cannot do alone, but we will let them continue to do the things for themselves that they can do.
How will I know what I'm supposed to do with each patient?
I'm so glad you asked, Cassie. As the registered nurse caring for these patients, that's my job. When a patient gets admitted to our facility, I will do a head-to-toe assessment. I will review all body systems to evaluate the patient for real problems and potential problems. This is a very long, complicated process, but here's a brief overview of a general assessment. I'm going to look at his neurological status. I'm going to look at his cardiac status and his respiratory system. I will also look at his integumentary system, which is hair, skin, and nails, and his gastrointestinal system. His urinary system is important, as is his musculoskeletal system. And then I will review his endocrine, lymphatic, and reproductive systems. And finally, I will review the doctor's orders for this patient. I will use all of this information to determine the patient's real and potential problems. Here's an example to put it into perspective. Let's say that this patient has just had a right hip replacement. Now we know that she will need to continue her activities of daily living. She still has to eat, drink, go to the bathroom, bathe, groom, and dress. And after my assessment, I know that she did all of those things herself until today. However, she cannot get out of bed for any reason for the next 3 days. So, since we know that she must stay in bed, I have to figure out how to meet all of her ADL needs. The easiest way to evaluate basic needs is using the TEAMS method: toileting, eating, ADLs, mobility, and special. As the RN, I'll take all the information I gathered during the assessment to figure out the best way to help her. She can't get out of bed, so I have to figure out the best way to meet her elimination needs: bedpan or catheter. I also know she is at risk for constipation. Since she's not moving much and she's on pain medication, this is a potential problem. She can feed herself, but the trays must be brought to her in bed. She can't sit all the way up because of surgery, but she can't eat lying flat either. She has dentures, so they must be within reach at mealtimes, and they must be cleaned daily. She's able to clean herself as long as the supplies are brought to her, but she can't reach her legs or feet, so she'll need help. She is on total bed rest for 3 days, and she also needs her dressing changed every day. You can see how the RN uses all the information available to create a plan of care specifically for this patient. This is called a care plan, and it's something that only an RN can do. Of course, this was a simplified version of the care planning process. A real patient's care plan is much more extensive. Every single aspect of her health, condition, and ability level will be evaluated in order to help her. Even the smallest decision can have long-term consequences. The RN will write a detailed care plan for the entire healthcare team to follow, and the care plan must be followed exactly.
So every patient will have a different care plan?
That's correct, Ben. Every care plan will be different because every patient will be different. Even patients that seem alike because they have a similar diagnosis or have had the same surgery may have differences in care. CNAs don't have enough education or experience to know all the differences. So as a CNA, your job is to read and follow the care plan for every individual patient. In fact, you could say that your job is to follow the care plan, the whole care plan, and nothing but the care plan. Do you think you can do that? Can you follow directions exactly?
I can.
Absolutely.
Sure. Yes.
Awesome. Then you're well on your way to being a great CNA. But helping patients with ADLs isn't all that you will do. You are also there to help the nurses by making observations. The CNAs are the hands and the feet of the patient. If the patient is cold and cannot reach their sweater, you will get it for them. If the patient can't brush their own teeth, then you will do that for them. If the patient can't get up to shower, then you will help them stay clean. You will become their hands and feet to help patients with things that they can't do themselves. But you are also the eyes and the ears of the healthcare team. You will report everything you see, hear, smell, or feel to the nurse. This is the most important task that you have as a CNA. If you see redness around a wound, you must report it. If you hear the patient wheezing after walking to the toilet, you must report it. If you feel that a patient's skin appears warmer than usual, you must report it. If you notice that a patient is coughing when eating, you must report it. As a CNA, you will be spending much more time with the patient than the nurse does. So you will be in a position to notice a lot more about the patient. The nurse needs this information to make decisions about the patient's care. Reporting these observations gives the nurse another assessment opportunity. That new assessment may even change the tasks you are assigned to perform. This is called the nursing process, and here's how it works. The RN assesses the patient and develops the care plan. This gives you specific tasks to do. While doing those tasks, you notice things. You report those observations to the RN, and the RN performs another assessment to review the changes in the patient. That new assessment prompts changes in the care plan, and this gives the CNA new tasks to do. And the cycle continues around and around as the patient gets better or worse. This is a continuous process until the patient is discharged.
I'm not sure I understand. Are you saying the care plan is going to change all the time?
Yes, it could, depending on the needs of the patient. Let me give you an example. The care plan told you to make an occupied bed in room 201. As you changed the sheets, you noticed that the skin on the patient's backside was red and irritated. You notified the nurse, who then reassessed the patient. The nurse decided that the patient needed to be repositioned every 2 hours around the clock. This was added to the care plan as another task for the CNA. Using this model, we can respond to the needs of the patient quickly as their needs change. But it also works for patients that are getting better too. You've been assisting Mr. Hopkins with transferring out of bed and into a chair after surgery. But you notice he isn't leaning on you any longer. You notify the nurse. The nurse reassesses the patient and decides that the patient can transfer on his own now. The care plan is changed, and this task is removed from the care plan since the patient is improving.
Doesn't this mean that I'm going to be bothering the nurse all the time? Won't they be annoyed?
The nurse should never be annoyed with you for reporting changes in the patient. They are legally liable for every aspect of that patient's care. Since the nurse requires that information to plan the patient's care, they expect to receive updates from you on the changes that you see. But how often you will have to report changes to the nurse will depend on the setting you are working in. Nursing home patients are pretty stable and don't really change all that often. That's pretty common for long-term care facilities, like nursing homes and ALFs and even home care. But in other settings, like hospitals, rehabilitation centers, and hospice, patients' health can change rapidly. In those settings, nurses and CNAs are going to work closely, and constant communication is required. Since CNAs must follow the care plan and are not allowed to alter it, they can't solve problems. The RN is ultimately legally responsible for the care of that patient. If you have information about the patient that you're not giving to the nurse, the patient can suffer, and the nurse is legally liable for that. Remember, you are an assistant. You are there to help, but the nurse is always in charge of the patient. So all changes, regardless of how minor they seem to you, must be reported to the RN. When the patient is stable, you will not have much to report and may go days without talking to the RN. But if you notice something, then it must be reported, even if you don't think it matters. If you aren't reporting observations, the nurse can't rely on you anymore. And if the RN can't rely on you, then you aren't a good assistant to that nurse. You must report to the nurse everything you see, hear, smell, or feel. Be a good assistant and report all changes and observations. This is the most important job you have. So the care plan is developed by the RN, gives the team tasks, CNAs follow the care plan, and report changes. Let's recap what we learned today. Can you tell me how a CNA knows what each patient needs?
The care plan.
As a CNA, you follow the care plan, the whole care plan, and nothing but
The care plan.
anything unusual that you notice about the patient, you must report it to
The nurse.
Great job. For the exam, you will receive a care plan. What should you do?
Follow it exactly.
That's correct. If you don't follow the care plan, you will fail the exam. It's that simple. Now that you understand the care plan, I can show you how the skills will be done for the exam. But remember, you must always read and follow the care plan. That's a big part of the skills exam. Take the brief quiz below to make sure you understand. See you in the next lesson.
Sorry about that.
Okay, no, thanks. Good catch. All right. So what do you do if you can't follow the care plan? Report it to the nurse. Those are the only two options that CNAs have. That's it. That is it. You follow the care plan or you report it to the nurse. So what do you do if a patient refuses and you can't follow the care plan? Report it to the nurse. What do you do if you're assigned to do something but the patient doesn't feel well? Report it to the nurse. You guys see how easy this is? How hard can the test be? You either follow the care plan or report it to the nurse. That's it. That is it. You now have the information you need to pass a state exam. Follow the care plan or report it to the nurse. That's it. Now, we're going to learn how to do these skills because there's rules that apply to these skills as well. That's the other 10 banners we have to learn. But this is the first place that we start. Okay. So this was the care planning process that you saw in the video. As the nurse, it's my job to do a head-to-toe assessment on this patient. That's my job, head-to-toe assessment. Now, that means that I'm looking at every body system. I'm trying to come up with all real problems, all potential problems that might occur. That's a lot of work for me to do. And it takes a long time. But once I have that information, it doesn't do anybody any good if I've got it stuck in my head. You can't read my mind. So I could come up to you and I could say, hey, what's your name? Melissa. Hey, Melissa, I need you to go brush that person's teeth. And you could go brush his teeth, right? But that's okay if Melissa and I are the only ones that ever work with this patient. That's not realistic. There's multiple shifts and there's multiple caregivers and there's people that have to cover for lunches and break. I mean, there's a lot of people involved in taking care of this one person. So even though I can pass on information verbally and ask you to do something or ask you to do something, it's much better if we write it down. That way, all the team members have access to that information and it keeps all of us on the same page and we're all doing everything the same way. So the nurse assesses the patient and writes up a care plan. That care plan gives the CNAs tasks to follow. You're going to do whatever that care plan tells you to do, how it tells you to do it. While you're doing those tasks, you're going to make observations. Now, understand, those are the two things that CNAs do. They perform tasks as indicated on the care plan, and they make observations. So that's half of your job, is to make observations. When you make an observation, you're going to report it to me. If you make an observation but keep it to yourself, that doesn't help anybody, right? If you make an observation and report it to me, that means I will go in and reassess and figure out if we need to change something. So when you look at this graphic, these two things are the nurse's responsibility. These three things are the CNA's responsibility, and only one of them is what you think a CNA does. Make sense? Good? So you are stuck here. Right now you're learning. You're worried about how do I wash my hands? How do I give a bed bath? I want to pass that test. You're worried about this. But understand that this is only 1/3 of your job. We have to learn these two things as well. Good? Because this without that does not make a CNA. This is where a lot of people kind of go wrong with CNAs, with thinking about being a CNA, right? They judge CNAs by what they do. Well, I see a CNA brush teeth. I see a CNA walking a patient. and they think, oh, I can do that. And they're right. They probably could, because you've probably brushed your teeth at least once this month. I'm guessing, right? You've probably walked yourself somewhere, like into this room. So could you help somebody brush their teeth? Sure. Could you help somebody walk? Sure. I mean, that's not really hard, right? But this is where we focus. If you're just focused on skills, you've missed the point. You can't see somebody think. You don't see these two things happening. Does that make sense? Okay, so again, you now have the information you need to pass the test. We follow the care plan. Exactly. And then we report our observations to the nurse. If we can't follow the care plan, we tell the nurse. About 90% of the test is covered by that. 90% of the written test, 90% of the skills test, you now could reasonably pass the test. If somebody gave you a care plan, what would you do? Follow it. Absolutely. So this seems very simple now, doesn't it? This is kind of like a no-brainer. But let me show you something. This is why our program is effective, okay? I want you, in your yellow book, I want you to open up, I'm going to borrow yours real quick. In your yellow book, I want you to open up to page 271. And I want you to find care plan. It's toward the top of the second column. Page 271, toward the top of the second column, find care plan. Now, what do we know about the care plan? Okay, and what do we do with the care plan? We follow it. So that is central to a CNA. That is, CNA revolves around that care plan, right? So theoretically, this book that's teaching us how to be a CNA should have a care plan on every single page. It should point back to that care plan every single page. If you look at care plan on page 271, how many pages of this book does the care plan get mentioned? 2. So let's see what the book has to say about a care plan. Go to page 7 and 8 in your yellow book. It's one paragraph. This is why people fail the state exam, guys. Because this is the book used by most training programs. The only training that they get on the care plan are these 2 paragraphs on page 7 and 8. That's it. Now, what makes this even worse is that these people, if they pass the state exam, start working with patients. If they don't understand what a care plan is, they start making up their own ideas of what should be done with the patient. And that puts the patient at risk. So one of the things I used to do with students years ago is when they came in, the first thing I did was start out with a scenario. Okay. Before I ever trained them on anything, I would say, you're walking a patient or you're assigned to walk a patient, and you go to stand the patient up and they're a little bit woozy, just a little unsteady. What would you get? A gait belt, B, a walker, C, a wheelchair, or D, the nurse? The nurse. But before you watch that video, you would be split on walker, gait belt, and wheelchair. Do you see the difference? CNAs don't make decisions, but your brain will try to trick you into making a decision unless you understand this. And that's why people fail the exam. Good. So let's see just how prepared you are for the written test now. Turn in your book to page 20, your spiral book. By the way, I hate the yellow book. You're going to go home and use it for homework reading because I haven't gotten around to writing a replacement. In your spiral book, page 20. I want you to take about 5 minutes to answer these questions. Answer as many as you can in the next 5 minutes. And don't worry about it if you don't get them all answered. Just answer as many as you can in the next 5 minutes. All right, it looks like most of you guys are done. So we're gonna go ahead and talk about these. So if we look at question 1 is referring us to the care plan right beside it, and it asks how far we'll walk that patient. What do you guys think? How far?
10 steps.
Why? Easy answer. Why?
That's what the care plan is.
Because that's what the care plan says. What if the patient wants to go further? Why? Yeah, why? Exactly. So are you getting it? Getting it? Right? We follow the care plan. Doesn't matter what the patient wants. The patient is going to be consulted when we develop the care plan. The nurse and the patient work together to make the care plan. But the CNA has to follow that care plan. Exactly. So what are we going to use to help this patient walk? Gait belt. Why? Because that's what the care plan said. How hard can this written test be, guys? You are not allowed to think. If your brain says, well, I think, stop. Stop. You took a wrong turn. You took a wrong turn. We don't think. Thinking is the domain of the nurses. We don't have enough information to make an informed decision with. Now, there will be some questions on the state exam that are going to try to trick you a little bit. They're going to try to get you to think. So I need to remind you that we follow the care plan. Good? Good. All right. Let's look at question 3. Now, question 3 is on range of motion exercises. And we all know that exercise is good for the body, especially people that are recovering, right? We want to get blood flow to the right areas. Exercise is great. So, wouldn't you want to exercise as many body parts as you could? What do you guys think?
Not if it's not on the care plan.
Okay. So, yeah, exercise might be good, but we have to always follow the care plan. That's right. So, if you're looking at number 4, which body parts do we want to exercise here? Right hip, knee, and ankle. We're not going to do the left one too? Why? Not on the care plan. So this has actually happened. This has actually happened. A patient was in bed because they had a large blood clot in their left leg. Well, because they're in bed and they've got a blood clot, they're at risk for more because they're not moving. So the CNA was told to do some exercises on the right hip, knee, and ankle because we want to prevent blood clot formation. We want to get that circulation going in that leg, right? And the CNA thought, well, if exercise is good, I'm going to go ahead and do the left side too. Well, when they did, that blood clot broke loose and ended up in the patient's lung. CNAs don't always know everything that's going on with the patient. And you might think you're doing something good when actually you end up killing the patient. CNAs kill about as many patients as surgeons do every year. We just don't talk about it. I think we should be talking about it. How do you prevent killing your patient? You follow the care plan. Absolutely. Absolutely. Good? Make sense? Okay. All right. Now let's go down. I'm not going to do 4, 5, and 6 right now. I want to go down to number 7. And the reason I want to talk about 7 and 8 is because of this particular situation. This is one of the skills on the state exam, measure and record a pulse. This is something you might be asked to do on the state exam. It's the most failed skill on the state exam. The most failed skill. And it has nothing to do with the number that you get. Accuracy does not count on this skill nearly as much as you think it does. How long do we have to count the pulse according to this care plan? 1 full minute. How many of you guys know somebody that works in healthcare? Yeah, most people. If you go home and you ask the person that you know that works in healthcare, how long do you count a pulse for? They will say 15 seconds. You multiply that by 4 and you get your reading. Or they will say, well, you use that little clothespin thing, that pulse ox, and it gives you a number. Right? So if you listen to the people out there, you are getting a completely different thing than what this care plan says. So which one do we follow? Why? Okay, that's what the care plan says, but let's go one step deeper. Because counting a pulse for 15 seconds and multiplying it by 4 is actually okay. Using a pulse ox to get a number is actually okay. Those are accepted, normal ways of getting a pulse. So, why does this one tell us to do something different? So we have to go a step deeper to figure that out. This care plan is written for this specific patient. And for some reason, Could be a million different reasons, but for some reason, the nurse knows that that 15 seconds and multiplying it by 4 is not going to work for this person. That pulse ox, not going to work for this person. I need you to count that pulse for 1 full minute. Care plans are specific to the patient. That's why we have to follow them. Good? Does that make sense? Okay. So even though we might be working with a patient that has diabetes and we're given another patient that has diabetes, they may not have the exact same tasks, even though they both have the same condition. Because the tasks are going to be based on that specific patient's needs. Does that make sense? Okay. All right. So you're, for the test, going to be given 3 care plans. And you're going to be told, I want you to do these 3 things in the order listed. So for the test, you get 3 care plans that you have to follow, and you've got to do them in the order they give them to you. Wouldn't it be nice if you could see the care plans that the state's going to give you during testing? Wouldn't you want that?
Yeah.
Yeah, here they are. These are the actual testing care plans. So if you get pulse as a skill during the test, this is exactly what that care plan is going to say word for word. If you get range of motion for the test, this is exactly what that care plan is going to say word for word. If you get feeding for the test, this is exactly what that care plan is going to say word for word. But this is only 4. You've got 20 that they could give you. 20. Do you want the rest of them? Go to page 25 in your book. During the exam, you're going to be given 3 care plans. You have to follow those care plans exactly and perform the skills exactly as indicated on the care plan. Now, instead of giving you 3 separate sheets of paper, they're going to combine all 3 of these care plans onto one set. It looks like this. This is a care plan set used by the state. Looks exactly like this. Mine's a little prettier. I put it on a clipboard. I put some backgrounds behind it, but it's still on yellow paper and it has the same words. Mine's just a little prettier. Okay. These are always up here for you to be able to see, but you have them in your book on page 25. What you see on page 25 is what's on here. All 11 of them. All 11 of them are on page 25. Now, this isn't random. You are going to get one of these 11 during the test. The skills are already divided up into sets by the testing agency. Each one of these sets has one ADL skill. Do you guys remember what ADLs are? Bathing, dressing, grooming, toileting. One mobility skill. That means we're moving the body or some part of the body. And one documentation skill. Now, everybody gets a documentation skill. And we're going to go over that in just a few minutes. Okay. Does that make sense? So you have all of the testing care plans here on page 25. There's also a physical copy in this classroom up here for you to be able to see anytime you want to. It's right up there. We're going to come back to that in a minute. All right. So here are our skill rules. We are going to perform the skill as directed by the care plan. We're going to follow the care plan, the whole care plan. Don't leave out any parts. And nothing but the care plan. So don't add your 2 cents in. The care plan stands alone. While you're following that care plan, you should be making observations. How does the patient respond? Are they dizzy? Are they weak? Are they doing a little better today? Did they eat all of their lunch? Did they refuse their lunch? Make observations, and then we're going to report those observations off to the nurse. Everything you know, the nurse knows. You should never, ever, ever have knowledge that the nurse is not aware of about your patients. Ever. If you know something the nurse doesn't know, you took a wrong turn. Good? Now, how much you talk to the nurse is going to depend on the setting that you're in. If you are in a hospital setting or a acute care rehab setting where your patients are changing like all the time, things are happening quick, you're probably going to be talking to the nurse a lot because things are always changing. Have you ever been in a hospital? Have you ever been a patient in a hospital? We don't get to make a reservation at a hospital. Like, I really need a break. But I can't call up my local hospital and say, hey, I'd like to reserve a window room for 3 days. You can't do that. In order to get a room at a hospital, I have to go in through the ER, and their job is to not let me in. That is their job. The ER's job is to keep you from being admitted, stabilize you, send you out. That is their job. Now, sometimes they can't do that, and you have to be admitted, but you've got to prove that you're sick enough to have that bed. That means that the very sickest people in our community had to prove that they're the very sickest people in our community to get those beds. Now, we don't want them there very long because we got a whole lot of other people that want to come in. So our job is to stabilize them and get them shipped out. That means that those patients are very sick and changing quickly. So you're going to have to talk to your nurse a lot. Now, if you're working in a nursing home, this is where people live. They're there until the end. And they need nursing care, but they're pretty stable, right? They may have tube feedings or wounds, or they may need frequent assessments by the nurse, but overall, they're pretty stable. Monday's just like Tuesday. Tuesday's just like Wednesday. Wednesday's just like Thursday. Nothing ever changes. You might go weeks without talking to the nurse because there's nothing to report. Henry is Henry. Henry's been Henry. Nothing has changed with Henry. We don't need to report anything with Henry. So it depends on the setting that you're in as to how much you'll have to tell the nurse. Good? Do you guys get it? All right. So we follow the care plan, the whole care plan, and nothing but the care plan. And then we report all of those observations to the nurse. So if we have knowledge, the nurse has to have that knowledge. Okay. You've just learned your first principle. Hasn't been hard. We're going to learn all the rest of them the same way. So by the time we reach class 6, way in the future, you will be able to recite all of those principles to you just as well as you can recite that we follow the care plan. It will become part of you. Now, when you get out there and you start working, you're also going to have a care plan. What are you going to do with it? Follow it. It doesn't change. It doesn't matter whether you're in the class or in the test or in a working center. You are going to follow the care plan. It's that. There is no difference. Good? Good? All right. We're going to learn 2 more principles today before I'm done with you. This is just one. All right. Okay, so page 25. See, I forget to hit these buttons. Page 25 gives us all of our care plan sets that we're going to use for the state exam. There's 11 of them. Now, at the top, you're going to see a little clock with a number in it. That tells you how long you're going to have to do that set of 3 skills for the exam. We're going to get to timing a little bit later, but understand you got way more timing than you actually need. Don't stress out about timing. My students never, ever, ever time out of skills. You got way more time than you actually need. The people that time out are those that start over and over and over and have to think about it. You guys are going to know what you're doing, so you won't time out. All right, we've already looked at that. Okay, so the page before, and I've already gone over this too, I just want to show you in your book where it's at. I told you that each one of these skill sets has an ADL skill, a mobility skill, and a documentation skill. This little lesson here is just showing you that. We've already gone over that. So I'm going to leave this up for a second because you guys might want to go back. This is not in the book, but you guys might want to go back and review this later. I also have a video on this. Okay, so if you go back, let's go back a page. See how there's a video clapboard here? And it says CNA or skills categories on the exam. You see that? If you go to my main website, foryourcna.com, up in the top, you'll see menu. The very first one is training. Well, if that's what you're doing right now, right? You're in the training portion. So if you click on that training menu, it's going to open up and you're going to see animated lessons. These video clapboards are mostly going to be found in those animated lessons. So if you click on animated lessons and go to that page, you'll be able to see this video. And it has, that video has this graphic. So that's where you would find this. In your online course, you know the video we just watched? That is the second lesson in the online course, that video. So when you get your care plan set, and each one has ADL skills, mobility skills, and documentation skills. These are all the skills that are ADL skills that fall under that category. So things like mouth care and denture care and dressing and making an occupied bed, foot care, partial bed bath, peri-care, catheter care, bedpan, all of those are ADL skills. Now, mobility skills means moving a body or a part of a body. So we have 3 range of motions we're going to learn. That's just exercise. We have transferring from bed to wheelchair, walking a patient, which the fancy word is ambulating, and changing a position. So we're turning them on their side and propping them there with pillows. Those are all mobility skills. So mobility is moving a body or part of a body. Documentation skills, there's only 4. There's pulse, respirations, feeding, and emptying the drainage bag. You will get one of those 4, guaranteed. Guaranteed. You will get one of these. Now remember, I said the most failed skill on the exam is pulse. More people fail pulse than any other skill. There's some hard skills on here, and more people fail pulse. But they don't fail it because they don't know how to take a pulse. They fail it because they don't follow the care plan. That's right. So none of you will fail pulse because you know to follow the care plan. Good? So we've automatically improved your score by at least 50%. And we haven't even learned the skill yet. Good? All right. So let's go to page 22 and learn a little bit about what a CNA is, our scope of practice. So we already know most of our scope of practice. We follow the care plan. That's pretty easy. But there's a few other things here that we have to talk about. So the nurse is going to go in and assess the patient and develop this care plan. We're going to follow the care plan. We know that. That's old news. We've already covered that. We don't need to go over that again. But that's not the whole story here. It's important that you understand that as the nurse, This patient is my responsibility, 100%. I am licensed, so I hold liability. Licensed equals liability. Now, CNAs are certified, not quite the same as licensed. Certified means you've passed a test. Somebody has watched you do some things, said, yes, you're meeting the criteria, you're safe to practice on real people, go forth and conquer. That's certified. Licensed means that you hold liability for everything that happens to this patient, whether you did it or not. So, as a nursing assistant, we're there to help the nurse, and the nurse has the liability. That means that everything you do, the nurse is liable for. Good with that? So let me give you an example, okay? Let's say that you have a 12-year-old child. 12-year-olds, they know a thing or two. They think they're grown up. They're not quite there yet. They're not always thinking with adult thinking brains, right? Sometimes they make some boneheaded decisions, and yet the parent is still legally liable for those boneheaded decisions. Does that make sense? So if you have a 12-year-old that gets a parent's, I can't say the word because I will be censored, firing apparatus, puts it in their backpack, and takes it to school and shows it off to a buddy. Hey, look what I got. Who's going to get in trouble for that? The parent, because the parent failed to adequately supervise the child. So the liability is with the parent. Same situation with nurses and CNAs. The nurse is liable for everything you do. This is why you cannot have information the nurse doesn't know. Good? Good. Because if that 12-year-old had told their dad, hey, Dad, I'm going to take this for show and tell, the dad would say, stop. Not a good idea. Right? So you can't have knowledge your nurse doesn't have. That is your scope of practice. You are going to follow the care plan and share all of your knowledge with the nurse. Does that make sense? But there's a couple more things here that are going to play into this that we have to discuss, because this is a very simplified. Yeah, we see a patient, we follow the care plan, report to the nurse. That's pretty simple, but there's a few other things that we have to think about as far as our scope of practice goes. CNAs have a specific set of tasks they're allowed to do. Now, who gives them the authority to do that? It's going to start at your state legislature. So in the state rules, we call them statutes and processes, we have, it's called the Florida Administrative Code for Florida. We have rules that govern what nurses do, what CNAs do. This is what keeps nurses from performing surgery, right? It defines what tasks are appropriate for that level of education. Well, CNA scope of practice defined by our state legislature is very broad. Basically, it's, yeah, you can do whatever the nurse thinks that you can do. So we are wide open for delegation. Not every state is like that. There are some states that say, okay, listen, these 5 tasks, the CNAs are not allowed to do. They're just not allowed. They're way too complex for CNAs. Florida's a little more liberal, but you have to know that your practice is governed by the state statutes. Now, so we have that way up here. We don't really pay attention to that. When's the last time you opened up the Florida state statutes and looked up anything? Probably never, right? We don't really care about that. That's way up here. What's more relevant to you is your policies and procedures where you work. because those policies and procedures are going to take into account those state statutes. So they're a little closer to us. How many guys work? Wherever you work, you have to have a policy and procedure manual. Every workplace that has employees is required to have a policy and procedure manual. And it tells you how to do whatever it is they want you to do. How many guys have ever looked at your policy and procedure manual? Yeah. Most of you don't even know where it's at. It's a dusty binder on a shelf in a manager's office. I have no idea what it says. I don't know what that is your set of instructions. You need to know what's in that policy procedure manual. Like, you really need to know. And the reason for that is this. That is what's going to encompass your scope of practice. It tells you what you're allowed to do and what you're prohibited from doing. And it's going to be based on the state statutes and how much liability the facility is willing to absorb. So let me give you an example. This is a real world example. Just came out 2 weeks ago, this situation. So current events. So back in 2023, I think it is. Now, I might have my dates a little off, but I think it was 2023. There was a nursing student. He was going to nursing school. And they were in a hospital up in Ocala, which is not too far from us. And they were doing clinicals. Now, when you do clinicals, you don't have an instructor like right behind you the whole time, right? There's one instructor, there's 12 students, and they're all kind of roaming and being assigned to different units and different things, right? So this nursing student is walking down a hallway, sees a call light go off. And the nursing student walked in, and the patient, and I don't know the exact details of this, but the patient either asked to get into bed or out of bed. I'm not sure which one. And the nursing student's like, okay, I'll help you. Sounds simple enough, right? So the nursing student helped the patient either into or out of bed. I can't remember which one. And the patient slipped and fell, hit his head, and died. Horrible. I mean, the family is like grieving. This is a dead person, a person with a family. Now, that policy and procedure manual at the facility specifically instructed any students to be told what tasks to perform by a nurse. So this nursing student went in, thought he was doing a good deed, right? Thought he was doing a good thing by helping. Patient wants up, we'll help the patient up. But that nursing student did not have direct supervision of the nurse caring for that patient. They weren't told to do that. They had incomplete knowledge. And as a result of that, the patient fell and died. Now, family sues the hospital. That's expected. And they settle out of court for an undisclosed amount of money. And in my opinion, no amount of money is ever going to bring that patient back, so it's not enough. But now the hospital is going after the nursing school because of liability. That student did not follow the policy and procedure of that facility. Those policies and procedures are a whole lot more important than you think they are when we're working with real live people. So your scope of practice is going to be defined by the statutes of your state, the policies and procedures of your facility, and the care plan specific to this patient. All of that together defines your scope of practice with one more component. That last component is training. You have to be trained to perform anything on anyone. You have to be trained. Now, training doesn't have to be in a classroom like this. You are getting entry-level training here. We're kind of going over the basics, foundation. You're going to build on that. But training doesn't have to be in a classroom. Training can actually be at the bedside. I can bring Melissa, right? Guys, it takes me like 4 weeks to learn your names. So if I bring Melissa over and I say, Melissa, this is Matilda. I'm going to show you what I need done on Matilda specifically, right? That's training. I've taught you what to do. I watched you do it, and you know to come to me if you have any questions about what you're doing with Matilda. That's training. Training can also be done by an education coordinator at the facility. Most big facilities now have education people to take on the training so they can document that it was done and check you off and all those kinds of things. But training is training. Training is not pulling up a YouTube video and winging it. Now, there's a situation that I'm going to tell you about a little bit later, but I'm just going to go over it to illustrate this topic. So there was several years ago, well, probably more than several now, there was a receptionist at a radiology section of an acute care facility up in Georgia. Okay, so she's a receptionist. She answers the phone, she makes appointments, calls people, you know, that type of thing. Well, there was an older woman patient who was getting some x-rays. And the older woman had a hard time walking. Her daughter was with her. After the x-rays, she's in a wheelchair, and the daughter goes out to get the car to pull it up front so they can bring the patient out, get her in the car, and they can go. No problem. Routine. This happens all day, every day. But a transporter was supposed to come bring the patient in the wheelchair to the car and help her get in. We have transporters for that. They've been trained for this. Transporter was tied up, busy, couldn't come. The daughter's car is now in the front roundabout thing, blocking traffic. The receptionist thinks to herself, well, I can help. Takes the patient in the wheelchair out to the car. Doesn't know to lock it. Flips the little foot pedals up, but doesn't move the leg rests out of the way because doesn't know that that's important. And as she helps the patient to get up, the patient trips over the leg rests and the curbing and falls and breaks her leg. The receptionist lost her job. She was doing a good deed. Why did she lose her job? Scope of practice. That's right. She was not trained to do that task. She had nobody's permission to do that task. She was not told to do that task. She operated outside her scope of practice. Please be careful. Your scope of practice is the one thing that will cause you your job every time. So if you have not been trained to do a task, what do you say? I haven't been trained. I can't do it. It's not in my scope of practice. Now, as the nurse, I can say, oh, I didn't know that. Come with me. I'll train you. I'll show you how. Well, now you've been trained. That's okay. Remember, training doesn't have to be in a classroom. It can be at the bedside. But don't just wing it. Make sense? That's your scope of practice. Now, one of the things that goes into scope of practice is a concept called delegation. Where's delegation? Hold on. There it is, page 14. I got to reorder these. This is going to go into your scope of practice. I have a whole video on this. You can watch the video if you want. It's in the online course. There's a whole lesson on it. But as a nurse, there are some things that I have to decide before I can assign you to do a task. So if there's a task that I don't have time to do, let me back up real quick and explain this. As the nurse, I have to do those whole head-to-toe assessments, and they take time. I've got to talk to the doctors. I've got to monitor lab values. I've got to arrange for testing and review the results of the testing. I have to coordinate with families. I've got to do discharge instructions. I've got to hang IVs and do medications and treatments. And there's a lot going on here, a lot for me to juggle. So I have complete responsibility over this patient and whether or not her teeth get brushed. But I can assess another patient or I can brush her teeth, but I can't do both at the same time. So what I'm going to do is delegate one of those two tasks. Now, assessment is something that only a nurse can do. That's it. Only a nurse can assess. But brushing teeth, that's something pretty much anybody can do. So which of those two tasks am I going to delegate? Brushing teeth. Now, if there's something specific you need to know about this patient and brushing their teeth, that's going to be in the care plan. Otherwise, I can say, hey, just go do mouth care on her. She hasn't had mouth care yet. Go do mouth care. Go brush her teeth, right? There's nothing special. Just go brush her teeth. If there's something special, I would make sure she's sitting upright, please, right? Something special. But that's going to go into delegation. I've got to figure out what tasks I can delegate. There's some rules with delegation. The first rule is it something that I can do as a nurse? If it's not something I can do, I certainly can't delegate it. So that's kind of a no-brainer rule. Like I can't delegate, hey, will you go do a tracheostomy? You're like, what is that? But it sounds bad. I'm not doing that. So your answer is always, have I been trained? If the answer is no, that's a default. I haven't been trained. No, I'm not doing that. So the first thing is, have I been trained to do this? The second thing that I have to consider is, have you been trained to do this? And I may ask you, hey, do you know how to do an EKG? Have you been trained to do that? So your nurses may ask you, because nurses are going to work with all kinds of CNAs, and not all of them have the same level of experience or training. So the nurse may ask you, hey, do you know how to empty a drainage bag? Do you know how? Have you done that before? The nurses might ask you, be honest. Okay, so the first question is, have I been trained? The second question is, have you been trained? And then I need to know the state statutes, right? And my employer policies and procedures. This is something I'm allowed to delegate. Allowed to delegate. Because even though the state statutes in Florida says, yeah, CNAs can do pretty much anything you've been trained to do, facilities may not agree with that. Because if somebody is going to get sued, it's going to be the facility. So even though, good morning. Go ahead and have a seat. Even though you, let's see here. Even though, let's say that you worked in same-day surgery, post-op, patients get ready to go home, you were trained to remove IVs. It's something you guys can be trained to do in certain situations. So you are now working in my facility and I ask you, hey, do you know how to take out IVs? You go, oh yeah, I did learn how to do that. I used to work in same-day surgery. I know how to do that. And I'm like, cool. But I still have to go look at that policy and procedure manual because the facility may restrict that to nursing personnel only because of the risk of infection. And if there's an infection, there could be a lawsuit and then the facility would have to pay. So I'd rather have a nurse do that to limit my exposure. Make sense? So the nurse has to figure out, is this even allowed? So are you allowed to do it? Am I allowed, or am I allowed to do it? Have you been trained to do it? And is it allowed by our statutes and policy and procedure? So if all of those are yes, good to go. We have two more questions. One of those questions is, does this require judgment? Will you have to make any decisions while you're doing this task? Because CNAs aren't allowed to make decisions. It's black and white. You do it or you don't do it. Black and white, okay? No decisions. No, well, if this happens, then there's no if-thens in CNA work. So the last question is, do you know how to handle an emergency? How do you get in touch with me? What if something goes wrong? Okay, so there's a whole lot of things that nurse needs to do before they decide to delegate something to you. From your standpoint, you just have to know, have I been trained to do this? Okay. So in order for this to happen, remember I said that nurses can't do if then, right? It has to be black and white, no decisions. That means your patient has to be stable. So a lot of CNAs want to work in high energy places like the ICU or the ER or mother-baby unit, right? High energy places. But high energy places often have patients that are not stable. And CNAs have to work on stable patients. We're not allowed to make decisions. And high energy places often require quick decisions, not stop, go get the nurse and let them make a decision, quick decisions. So you're not going to see a lot of openings for CNAs in these high level places. Sometimes you will. Most of the time, we're going to call them something else, like a patient care tech. Because as a CNA, we have some rules to follow. You guys understand that from a legal standpoint? Okay. So, wow, that's a lot, isn't it? That all goes under your scope of practice, which includes delegation. So, on page 13, you've got this graphic here. You'll also see it on the bottom of each one of these banners, and this is there to remind us about our scope of practice. So everything I just said, the last 25 minutes, can be summed up into this one graphic. So at the base of everything, we follow the care plan, the whole care plan, and nothing but the care plan. That never, ever changes. That is the basis of what being a CNA is all about. That's what we stand on. We don't change the care plan. That tells us what to do. Now, that just provides a basis, though. Everything else is kind of wide open. We have nothing to help pin us in. So we need some rules to help pin us in and keep us safely in our scope of practice. And one of those rules is CNAs do normal. So that word normal means a routine task, something that you do all the time, on a stable patient, no if-thens, no judgments, no thinking involved, that you have been trained to do. So a routine task on a stable patient that you have been trained to do. That is what we call normal. So anything you'll ever be asked to do should fall under normal. You should be able to say, oh yeah, cool, I'll do that. Yep, I can 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 do normal. Every day, boring. Nothing that makes you sit up and go, huh? Because if you're going, huh? That is not normal. Good? Routine. So that kind of helps pin us in. Now, the other side, to keep us in our scope of practice, are principles. Now, I've already learned one principle, skill rules. We follow the care plan, the whole care plan, and nothing but the care plan. This gives us what we're going to do. The rest of the principles are going to tell us how to do it. So if we are going to wash a body part, there's some rules involved with that. If we're going to use supplies, there's some rules involved with that. If we're going to use a basin, there's some rules involved with that. If we are going to use gloves, there's some rules involved, and we still have to learn those rules. But those rules together are called principles. As long as we are doing normal, following the care plan, routine tasks on stable patients that we've been trained to do, and we're doing those tasks this way, we're good. We have no liability. Care plan told us what to do. These two things tell us how to do it. No liability there. That's good. Because I like my car. I don't want to lose it. No liability there. Stepping outside of this. Doing a task in a way that you were not trained to do it, that the care plan does not tell you to do it that way, you are now liable. Making a decision, you are now liable. Good? Do you like your cars? If you like your cars or your house or your money, you need to be in here, not out here.
Patty, what page are the principles on?
Principles are on page 27, I believe. Yeah, 27. So our basis is following the care plan. These two things tell us how, and then we have this roof to kind of keep us from kind of going out there in the middle of nothing. We got to have a roof in our house to keep us in our happy CNA place. So above all else, we have to remember that as a CNA, it's really easy to get tied up in the tasks and forget that there's a patient under all those tasks. So this keeps us above everything else. It is all about the patient. Right? We need to restore humanity to healthcare. This is not a lump of flesh laying in a bed that we're going to do stuff to. This is a living, breathing human that has a family, hopes and dreams, a story, a life. And we need to honor that and not get so caught up in the specifics down here that we forget that this is a human. And we're going to learn a whole lot about that as we go through the program. It's not enough to be technically accurate. You got to remember, this is a human, so we need some humanity. And then the very last thing that we need to remember is that if it's something that we know, it's something the nurse needs to know. So we report all of our observations. So everything I've just talked about in the last hour and a half is summed up right here. Good? Good. All right, so you guys all have your t-shirts, right? Open up your t-shirt and look at the back of your t-shirt. Yeah, you can get yours off the front table. Look at the back of your t-shirt. You see the letter or the number 4, your CNA, they're big block letters. Inside those big block letters are words. I know they're teeny tiny, but they're words. So the top line, the for your, all of the words in that are all of the principles on your back wall. Everything we're going to learn that tells us how to do these skills are right there on your t-shirt. Now, the CNA, those letters, the words in those letters tell you important information or testing tips, things to remember during the test. This is a cheat shirt. My entire program is on this shirt. Now, at the very bottom, you'll see a QR code. If you open your camera, you don't have to do it right now, but if you open your camera and point it at that QR code, it'll bring up a website. That is our flcnatraining.com website where you can see the replays. There's links to our other resources. So all you have to do is scan that QR code and it takes you to our one-stop review site. So this truly is a cheat shirt. Okay.
That's great.
Now it's on the back, you can't see it. So that means that you need to pair up with a buddy because that's the best way to practice. Okay. Good? Good. So if you, as you're going through your career, if a nurse says, hey, can you? And your first question is, am I allowed to do that? The answer is, have you been trained? If the answer is no, I haven't been trained, your answer is no, I haven't been trained. If they say, can I train you? Yes. Be open to learning new skills. Questions? Okay, you're now at like 92% of everything you need to know to pass the test. All right, so we've already talked about delegation. So we talked a little bit about this too, but this is a nice graphic that I create. By the way, all of the graphics in this book I create. All of the graphics that you see on the videos are me. And that's because, I mean, I put a lot of myself in this program, but it allows me to teach you from my brain. So you get to actually see what's going on in my brain. But when you see these graphics later, it will trigger what I've said. So if you look at this, the scope of practice, right? Underneath the scope of practice, it tells you kind of what you're allowed to do. Outside of the scope of practice is where your liability lies. Don't get caught outside of the umbrella. Stay in your scope of practice. Otherwise, you step outside and you have liability. Now, let me explain to you how important this is. This just happened last week. A CNA went into a patient's room and was moving the patient with a Hoyer lift. This happened in Mississippi. Moving a patient with a Hoyer lift. Hoyer lift is a mechanical lift. You put a sling under the patient, the mechanical lift lifts them and moves them. Every policy and procedure manual requires 2 caregivers to operate a mechanical lift. 1, to pay attention to the lift. Because when you're paying attention to the lift, who are you not paying attention to? The patient. The second caregiver, their whole entire reason for being there is to pay attention to the patient. This CNA, now it could be that they were short-staffed. Absolutely. Hey, I know what it's like working out there with not enough staff. And the CNA made a judgment call. I got to move the patient. Nobody's around to help me. I'm just going to do it. CNAs do this all day, every day out there. But what does our policy and procedure say? 2. This CNA made a judgment call. She thought. Are CNAs ever allowed to think?
No.
She lifted the patient with the Hoyer lift. We don't know what happened. We don't know if it wasn't attached properly, if the sling broke, if it mount. We have no idea. I have no more information. I can only speculate on what happened. I have no idea whether there was a second person involved. I can only speculate, but only one person was held liable. Patient fell and died. This CNA was arrested and is being charged with negligent homicide. Homicide, not manslaughter. Manslaughter means accidental. Circumstances led to this. It's sad, it's tragic, I'm responsible, but accidental. Homicide is not accidental. This CNA is looking at spending the rest of her life behind bars for making a decision because she operated outside of her scope of practice, and she is now liable for that decision. This scope of practice goes way beyond a written write-up or being fired. You can be held criminally liable for operating outside of your scope of practice. So I cannot overstate this, how important this is. If your policy and procedure says 2 caregivers, how many do you need? 2, period. I don't care if there isn't enough staff. That is the facility's problem, not mine. I am not moving that patient until I have a second caregiver, period. And if the family is complaining, I'm going to tell them, hey, the person you need to complain to is located at the front of the building. Do not put your life and freedom at risk. Okay, good. Scary. Now, I don't say that to scare you off of healthcare. As long as you're following the rules, you're okay. I don't want that to scare you off of healthcare, but I do want to scare you off of operating outside of your scope of practice. I'm watching that case with interest. All right, so let's go ahead and take our break. We're going to take a 15-minute break. There will be a timer on the screen. Feel free. There's coffee and drinks in the refrigerator, bathroom out back. If you're a smoker, please make sure your cigarettes go in the can provided out front, not on the sidewalk. We'll be back in 15. Thank you. Oh, I'll take us back. That's my job. Sorry. I think it was 20. Oh, I didn't write it down. 26? Okay. All right. So we have a couple questions. Tasha asks, I never received an email. I even checked my spam folder. Should I call you after class? And Tasha, I believe you are a student. Let's see. Oh, yes. Yeah. And I remember speaking to you. I know you're coming on day 2. Jake will make sure, please send us, okay, do this. Send me an email to foryourcna@gmail.com. Jake will put it in the chat for you. Send me an email to foryourcna@gmail.com. And Jacob can then confirm your email address and send you out our after class wrap up email 1. And then we'll get you all caught up on Wednesday. All right, and Coastal says, good morning, all. What's the best video posted on this channel to assist with the CNA Prometric exam? Well, one video isn't going to get you there, unfortunately. There's a lot of content that needs to be covered. So your best option, honestly, is to continue to watch the live stream, and we're going to cover absolutely everything from theory all the way to skills and everything in between. So that's your best option, is to continue attending the live streams. All right. So let's talk about the test. Now that we know that we have to follow the care plan, we know our scope of practice, we know how to avoid liability, let's talk about how we're going to apply all of that to the test. There's something I have to do that I know I'm going to forget to do in a few minutes. So I'm just going to put a star there so I can remember to go back to it. All right. So you all have to take a state exam. I think most of you guys know that. The state exam is going to be comprised of a written test and a skills test. So 2 parts to the test. Our closest testing center is in Tampa. Those of you in Citrus County, you have a testing center in Ocala. So you can pick which one is closest to you. But our closest one is in Tampa. It's right off of the Parkway. It's not too bad, probably about 35, 40 minutes from here. It's not too bad. When you go to the testing center, the only things you're allowed to take in are your keys, your test admission letter, if you have it, if you've printed it off, and 2 forms of ID. Now, one of those forms has to be a state issued or government issued non-expired photo ID. And I'm stressing that because a couple of months ago, one of my students did not realize her driver's license had expired, went to take the test and was turned away because her license had expired. It cannot be used once it's expired. So, check your IDs, make sure that they're still valid. You can use a passport, a driver's license, a military ID, anything that has a picture on it for your picture ID. Your second ID has to have a signature. The names have to match between the 2. Most people use their driver's license and social security number. Okay, or social security card. That's the easiest because your social security card is signed. But you can also use a debit or credit card as long as you've signed the back. You can use a library card that you've signed. You've got some options there. But for most people, it's a driver's license and your social security card that go together. Make sure the names match exactly. If you have more than 3 names, and there are some people that have 4 names, you need to make sure that the names on both match. If one of them is hyphenated and the other one isn't, they do not match. If your driver's license has all 4 names, but your social security number only has 3, they don't match. They need to match. They had a situation. I know it seems excessive, right? But they had a situation a couple of years ago down south where somebody was actually being paid to take the test for other people. Yeah.
That's a good idea.
Yeah, no, it's actually not. It's, yeah, there were some pretty serious ramifications from that, but they've really tightened up security because of it. I know, crazy. What scares me is, let's say that I pay somebody to take the test for me. Does that give anybody any assurance that I can take care of your grandma? It's kind of scary. The whole purpose of this is just to make sure that you're safe enough not to kill anyone. This test has nothing to do with you, and that's what we're going to learn in just a few minutes. The test has nothing to do with you. Nothing at all. I know to you, it seems like the test is revolving around you, right? They're testing me, they're watching me, they're grading me. It's all about me. It's not about you. And we're going to discuss why in just a few minutes. Okay. All right. So when you go in, there's going to be 7 other strangers. You will not test with people in this classroom. Everybody is going to test individually. So you will be there with 7 strangers on testing day. When you go in, they're going to check you in. They're going to look at your IDs. They're going to compare it to the name that they have. And then they're going to send you to a waiting room. They'll also ask you a few questions. We'll get to that a little bit later. But the questions really have to do with not you testing, but other people testing. And we'll talk about that in a minute. Then they're going to send you to a waiting room. Once everybody is checked in, you guys are going to be sitting in that waiting room for about 20 minutes with nothing to do. Remember, you can't take your cell phone in. The only thing you can take in is your keys, your test admission letter, and your 2 forms of ID. No cell phones. No study material. Nothing to distract you. So you are sitting there staring at 7 other people or a blank wall. So what ends up happening is you start to talk to each other because you're nervous, and you're eventually going to get to, well, where did you go to training? Well, where did you, I'm so afraid that I'm going to fail hand washing because, 10 paper towels, I'm afraid that I'm going to, do something wrong and I'm going to fail. And you're going to look at them and go, 10 paper towels. What does that mean? Well, you have to use 10 paper towels when you dry your hands, and you're going to go, I wasn't taught that. Now, which one of you was right? And you're about to go in and test. So on testing day, do not make friends. Turn your ears off and turn your mouth off. Do not make friends. You do not want to hear anything anyone has to say. You are going to rely only on what I tell you. And if anybody says anything different, you're going to wish them well. Okay. I'm not telling you that they're wrong. How many of you guys cook? Okay. There are about 500,000 ways to make a meatloaf. Which one's right? Probably the one you make, right? These skills are the same way. There's 500,000 ways to do these skills. I'm going to teach you one way that meets all of the checkpoints. Don't deviate from that. But that doesn't mean that somebody else's skill is wrong because they use different steps. Okay, good. What I don't want you to do is get into a shouting match with somebody in the waiting room because you're convinced that your meatloaf is the only meatloaf that is correct. Okay. So you're going to go into a waiting room and you're going to sit there for probably about 20 to 30 minutes with nothing to do. And you're going to be wondering, why don't they start the test? What are they doing? What's taking so long? And you're going to be tapping your foot and, climbing the walls and things like that. I want you just to kind of take some deep breaths and relax. They are doing something very important during this time. In Florida, we generally have 2 RN evaluators. 2 people are going to grade you, and they're going to grade you independently. They cannot collaborate. So 2 people are watching you perform the skills. Now, like every other industry right now, there's a shortage of evaluators. So there may only be 1. It's a possibility. But generally speaking, there will be 2. Okay. What they're doing during this time, where you guys are all sitting in the waiting room, is pairing you up. There is a scientific basis for this. It is not random. So 8 people a day test. They test 7 days a week. So you might actually test on a Sunday. They test 7 days a week. They do not test on major holidays like Thanksgiving. They will not test on, but Black Friday they will. When they have these 8 people, when you're checked in, they're going to ask you, do you have any conditions that would keep you from being a patient for any of these skills? Because most of the skills are going to be demonstrated on a live person. There are 4 skills demonstrated on a mannequin, but that's only 4 out of 20. That means 16 skills are going to be demonstrated on a live person. So if you have transfer from bed to wheelchair, you're going to have to do that on a live person. If you have feeding, you're going to have to do that on a live person. Range of motion, live person. So that means that you're there to test, but you're also going to be a patient for somebody else that's testing. When you're a patient, you're going to get a very specific script. You're going to follow it. You're going to be you, not a 90-year-old version of you. You're going to be you now. So if somebody's feeding you, you're going to eat. If somebody's walking you, you're going to walk. You're not going to try to win an Academy Award by, just kind of crawling along. That's not what we're doing here. We're going to be us. You're also going to be told what to say, where to be, and how to act. Follow those instructions when you're the patient. Good? But this is a very methodical pairing. So if you get ambulate with a gait belt, I need to put somebody with you that is about your body size or smaller. If you're going to feed somebody, I don't want to pick the largest person in the room for you to feed because there could be a little stigma there. That could be a little off-putting to someone. They may feel that they were singled out, right? If you have to brush somebody's teeth and somebody just had some oral surgery, well, we don't want them bleeding. So that's not a good candidate for us. So when you get checked in, they're going to ask you, do you have any conditions that would keep you from being a patient for any of these skills? You're going to tell them if you've just had oral surgery or if you've got athlete's foot on one foot that's cracked and bleeding, or if you have a prosthetic limb, something like that. You want to let them know, okay? Other than that, they're just going to pair you up with somebody that you would be a good fit for their skills, and they would be a good fit for your skills. Good? Now, this takes a few minutes to do. The harder you make it, the longer it takes. Nobody wants to have their teeth brushed. I get it. But if all of you come in and say, yeah, I just had oral surgery, that's going to be a problem. Right? So don't make this more complex than it actually has to be. But if you have something, please let them know. And I'll give you a really funny example of this. Wasn't funny at the time. We were a testing center here in Spring Hill for many years. And one of the evaluators comes out during the middle of a test. Comes out and she is white as a sheet. She is sweating. And I'm thinking, because she's an older lady, I'm thinking, oh my gosh, she's having a heart attack. And I'm like, what happened? She says, oh my God, I've never had this happen. I've never had this. And that's all she kept saying. I've never had this happen. I don't know what to do. I've never had this happen. And I'm like, what happened? Because now I've got to know, right? Well, it was one of my students. I had a student that had been in an auto or a motorcycle accident and had lost her leg, and she had a prosthetic leg. Now, for the first 3 or 4 classes, I had no idea because she was wearing long pants and she walked just fine. She had accommodated. She'd had this prosthesis for a very long time. She was fine with it, right? Never really dawned on her. I didn't think to have her mention it. And of course, she gets paired up with somebody who has to do range of motion on the leg. So that's the backstory. So she doesn't say anything. She lays down in bed, and she's kind of a trickster, right? Practical joker type person. She thought this was going to be hilarious. So the person being tested, now remember, this is a test, people, right? Emotions are high. This person puts their hands under and goes to lift, and you expect a bit of weight to a leg. And as she lifts with a little force because she expects some weight. And the prosthetic comes off. The person testing drops the prosthetic and starts to cry. And the evaluator is like, had a hard time recovering from this. And the person being tested was so distraught that she couldn't continue the test. Now, my student is laying in bed laughing her butt off, right? She thinks this is the funniest thing ever. And the evaluator she stepped out, tried to gather herself, went back in and basically put both of them back out in the waiting room, let everybody calm down, paired my trickster up with somebody else, right? And resumed the day. But by then, the person that was being tested was so just in so much turmoil that she was unsuccessful at the test. And I feel really bad about that, you know? So, although at the time, please, if you do have something, declare it. Okay. If you've had oral surgery, let them know that. We don't want somebody bleeding because remember, this is a test and we want stable. We want normal. We want no surprises. Okay. But don't make something up to get out of being a patient either. All right. So they've got 8 people, 8 strangers, and the evaluators are going to go through this criteria to pair you up in very specific groups of 2. This is not random. Once they get you paired up, and I'm gonna do this random just for the sake of this class. So you 2 are group 1. Don't go anywhere. Okay. You 2 are group 2. You've got about 45 minutes to an hour to kill. So you don't have to stay in the waiting room. Remember, you can't have anything in there. So you can go out to your car and you can study, or you can, watch YouTube videos or take a nap. I don't care what you do. Just be back in here in about an hour. You 2 are group 3. You've got about roughly an hour and 45 minutes to 2 hours to kill. So target clearance shopping, clear your head, get some coffee, come back in about 2 hours or about an hour and 45 minutes. Okay. You 2 are group 4. You've got about 2.5 hours before you have to be back. So Chili's 2 for 1 margaritas. We'll see you in a little while. You guys are going to be brought into the testing room. Now the testing, so they've paired you up into groups of 2. And when you go into the clinical skills room, it is a actual room. It has 4 walls. It is small. No one else can see what's happening in that room. You're not on a stage. You're not performing in front of hundreds. There's only 4 people in the room. You, your partner, who's going to be your patient, and the 2 evaluators. That's it. Closed door. Everybody else is down the hall in a waiting room. They can't see or hear what's happening. So it is a private testing experience. Now, once you're in there, the evaluator has to kind of show you around. You have no idea where to find the washcloths or what we're using for a privacy curtain or how to work the bed. You have no idea about any of that. So we have to show you around and show you how everything works, where everything is located. It's kind of like orientation at a new job. You're just going to kind of be shown around. But we don't expect you to remember all of that. If in 15 minutes you have to ask, hey, where were those washcloths again? You can ask, where were the washcloths again? They'll answer those questions. What you can't ask is, how do I do foot care? Okay. So they will help you find supply or, be able to point you to where supplies are or how to work a bed control, but they can't tell you how to do the skills, nothing technical. Good? Good. All right. So now that you both have been shown around, I'm going to pick on one of you to go first. I'll just pick on you because you're closer. Okay. So give me a number 1 to 11. 4. So the computer randomly picked skill set 4 for this person to perform. And it's the computer that picks your skill set when you register for the test, not on testing day. So your skill set was picked by the computer 2 weeks ago. The evaluator has no control over your set of skills. This is to help prevent any bias. Because what if you accidentally parked in the parking space for that evaluator today and really ticked her off because she had to walk? And she turned around and she says, which one of you guys parked in my parking spot? And you go, me? Oh, I'm going to give you the hard skills. We don't want that. This is very, very unbiased. Good. So the evaluators have no control over this set of skills. So I can't even trust that you know how to read. The evaluator is going to read the care plan to you. So you have provide mouth care to a resident with dentures, measure and record respirations, and transfer resident from bed to wheelchair. And they would read you the actual care plan for each one of those skills. And then they're going to hand that to you. And that is yours throughout the entire test. You can go back and read that anytime you want to. You can be in the middle of providing denture care and go back and read that care plan. That is yours through the test. When you're done with all 3 of those skills, the evaluator will take that back. You would then become the patient for her to do her skills on. You would get a different care plan, usually. And remember, they're going to pair you up, right? So generally speaking, they don't pair up 2 people that have the same skill set. Sometimes they will have to. It's a possibility. But guys, there's no problem with that, because if you haven't learned how to do mouth care by now, watching somebody else in the test isn't really going to help you. Okay. Make sense? So you would get your care plan set. It would be read to you, handed to you. You will do your 3 skills on this person. You will both go back out to the waiting room. You're done with the skills, but don't go anywhere. You still have to take a written. We're not done yet. Usually, we're going to talk about that in a second. Usually. So then you guys would be brought in. You'd be shown around. You will get a care plan. You'll do your skills on him. He'll get a care plan, do his skills on you. You'll go back out to the waiting room. You guys will be brought in. You do your skills. You'll do your skills back out to the waiting room. You guys stumble in from Chili's. You do your skills. She does hers. Back out to the waiting room. All 8 of you have now done your skills test, and now you'll go into a computer room to do the 60-question written test on the computer. Now, what did you just ask? Okay, thank you. I knew there was something there. All right, that's generally how it's done. Generally speaking, skills are done first and then written, but not always. The reason for that is because if you fail one portion of the test, let's say you fail the skills and pass the written, you only have to retake the skills, the portion you failed. More people fail skills than written. So because of that, they usually do skills first. That way, the person that's testing twice, they'll be in the first group. They can get their test done and go. They've already done their full day. They've done that already. So they'll get them tested and get them out so they don't have to stay all day. But if we have people there that have to retake the written test, sometimes the evaluators will do the written first to get those people out so they don't have to sit around and wait for 3 or 4 hours until the written test. So the evaluators have latitude as to which comes first. Good. You can pass that around so that everybody can see it. So everybody understand this graphic. The evaluator reads the care plan set, gives it to the person being tested, and the other person becomes the patient. Yes? Questions? Okay. All right. So I'm passing around the care plan set. It'll make its way around, but on the back of each page, so the page lists the 3 skills. On the back are the actual checklists that are used during your test. This is exactly what you are going to be tested on. Now, I'm going to teach you how to do the skills, so every one of those check marks gets, or checkpoints gets a check mark. Good? Good. All right. So page 65 is going to tell you about skills grading. Each skill has very well-defined specific checkpoints that indicate competency. The evaluators can only grade with these checkpoints. That's it. The evaluator cannot make up an arbitrary rule they want you to follow. They cannot grade you on something they think is important. This is all that you can be graded on. This is what's called minimum skills competency. So basically, we are showing that we can keep somebody alive while brushing their teeth. That's really what most of this is about, is safety. Safety is going to be covered with the principles we're going to learn. But most of this is about safety. Okay? Very well-defined checkpoints. That doesn't mean that there aren't other steps that might be important later when you're out there working. Your policy and procedure might add in some other points or take some away. When we are testing, we're going to follow what I'm showing you. When you're working, you're going to follow your own facilities, policies, and procedures. Because remember, failure to follow those can lead to liability. Good? Good. The problem is this. How many guys ever played the game telephone in elementary school? So if I told you something and you told her and it goes around the room, by the time it gets way over there, what happens to the story? Oh man, it changes. It changes. I used to teach another class called Health Science Concepts, and I did that on day 1. The very first person that came in, or to come in, I would give them a sentence like, the pink hippopotamus rode a unicycle eating a strawberry ice cream. Okay, pretty simple sentence. And I would tell that person, during this class, I need you to tell somebody else and tell them to pass it on. So at the very end of class, I would ask, what was the statement? And everything had changed. It was no longer a pink hippopotamus. It was a purple giraffe or an orange penguin or a pink unicorn or something like that. They were no longer riding a unicycle. They were riding a bicycle, a tricycle, a trapeze, a trampoline. They were no longer eating a strawberry ice cream. It was mint chocolate chip or chocolate, or it could have been a Klondike bar or a pizza, or, I mean, it would just change. So we know that verbal passing of information from one person to another, especially over a period of time, things get missed, lost, or changed. Make sense? Okay. So understanding that, when you go to work somewhere, you're going to be partnered up with somebody, and they're going to train you. They're going to tell you how things are done at this facility. But they can only tell you what somebody else told them sometime in the past. And that person can only tell them what they learned sometime in the past. Chances are what you're learning has no basis at all in the policy and procedure. They're telling you to do something. Oh, we don't use bath blankets here. But if you go to that policy and procedure binder and you open it and you look at bed baths, it will tell you to use a bath blanket. Now, if you're not using a bath blanket and your policy procedure told you to, you are then liable. You guys understand that? So when you're being trained, you should always verify what you're being told with what? Policy and procedure manual. Yep. Good. That's how you protect yourself from liability. Don't trust. Well, this is just the way we all do it here. Okay, that's fine. You can end up in jail. Jail for you and jail for you and jail for you. Me? No, I'm going to stay here and keep getting a paycheck. Okay. Good. All right. So this is what they're going to use is the checklists to grade you. Now, these checklists are actually published. Anybody can access these. They are freely available. If you go to Prometric's website, you can look at these checklists all day long, right? Hardly anybody does, and very few people know this is even available to them, but it is freely available. Now, the problem with this checklist that's on Prometric's website is that it's only showing part of the story. There's another, it's still freely available, but nobody knows to look here. There's another section called Indirect Care Behaviors. Now, that Indirect Care Behaviors is on the checklist, all right? There are things you have to get checked off, but they're things that are not on the main checklist. So if you go on to Prometric's website to verify what I'm telling you, and everybody should always verify, make sure you're looking at those indirect care behaviors as well, because you're going to have to get those checked off too. What we're passing around, those checkpoints have the indirect care behaviors built in. So I've combined the two for you. Okay, good. Now the problem with this, and it is a problem, is that these are written for RNs, because that's who's grading you. You're being graded by RNs. So these checklists are written for RNs. So a lot of this stuff may not make sense to you. Like, did the candidate violate infection control principles? Well, I don't know. Did I? You don't know enough about infection control principles to know whether you violated them or not. They're written for RNs. So what I did was I took these checklists, I filtered them through this RN brain, and I created easy to follow roadmaps for you. So I wrote them for CNAs, and that's what we're going to see in this book with our step-by-step instructions. We're going to get to that in just a minute. But everything that I have written for you, all of the steps that are in the skills are based on the actual checklists that are being used. We're going to see them in action when we start watching skills, because on the screen at the bottom of at the bottom of the screen on every skills video, you will see the actual checklist written out as I'm performing the step on the screen. So it's bringing the checklist into the practice. Good. So when we're looking at these checklists as evaluators, we are going to have it's actually kind of a wax pencil, because the sheets are laminated like that. And as you do a step correctly, you get a check mark, just like that. When you don't do something, no check mark. If you do something but you do it wrong, no check mark. Anything without a check mark is called a deficiency, and this is what's going to be held against you during testing. So you don't get points. It's important to understand you're not getting points for doing something right or doing something extra or getting extra credit. You don't accumulate points. You get penalized for missing a step. So basically, you all start out at 100. If you don't do something, you get some points taken off. Good. Now, the next question, somebody in here is going to ask, how many steps can you miss and still pass? Told you, I've been doing this a long time. All right, the answer to that is, it depends. It's complicated. It's not as easy as you can miss 3 things and still pass. And that's because every step is going to be weighted differently. Let's talk about this lady here. Okay. Miss Penelope needs mouth care. Now, is she in a safe position for us to do mouth care on her? No. Why? Oh, what's wrong with that? Technical term for that is aspiration, breathing in liquid into the lungs, right? We don't want her to aspirate. So what do we need to do before we brush her teeth? Sit her up. Yeah, head of the bed up, get her sitting on the side of the bed. Hey, best case scenario, take her into the bathroom, let her brush her teeth of the sink. I don't know what this lady can do. I have to follow the care plan. All right. So we know we have to get her sitting up. Okay. It says she's going to remain in bed, so we'll put the head of the bed up. Now, if you've ever brushed your teeth, you know it tends to make a pretty big foamy mess. And we generally do this over the sink so that big foamy mess falls into the sink, not on our clothing. We don't like getting toothpaste on our clothing, so we generally lean forward a little bit and we're over the sink. When you're brushing somebody's teeth in bed, they're not leaning forward, they're sitting up kind of a little bit back. So where is all that foamy mess going to go? Yeah, all down here. What could we put on their chest to maybe catch some of that foam? Yeah, something. I don't care what you use. Use a towel, use a pillowcase, use a paper towel, use a washcloth, use a diaper. I don't care. Put something on their chest to catch that big foamy mess to keep their clothes clean. Good? For the test, we'll use a towel. It's easy. It's right there. We're good. All right. So if we forget to put a towel on somebody's chest and they get toothpaste on their clothes, will they die?
No.
If we forget to put the head of the bed up and we brush their teeth, could they die?
Yes. Yes.
So which one of those do you think is more important? Putting the head of the bed up, it's going to be weighted differently than towel. So in that particular scenario, if you forget to put the head of the bed up, you fail. One step failed you. Because it's not about you. If you forget to put the head of the bed up, you killed a person, a living, breathing, real person. Should you pass? No. Not on this planet or any other. The test is not about you. Never has been. So yeah, one step could cause you to fail. And I'm okay with that, because if I'm the body in the bed, I don't want you to kill me. Good. Now, there's other steps that aren't as important, like the towel over the chest. Yeah, you don't put a towel on my chest, I get a little messy. I'm not comfortable, but I'm not dead. That's okay. You can miss a few of those and still be okay. It depends on how important the step is. As a student, you probably have no idea how important any step is, so this isn't easy for you to gauge. And the actual grading weights are not published. So I don't even know which steps have what number assigned to them. But I do know which ones are failing offenses. My job is to teach you in such a way that it would not even occur to you ever to brush somebody's teeth unless they were in a sitting position. It wouldn't even register. Like, whoa, wait, hold up. They're laying down. Okay, good. Makes sense? So my students don't generally fail on big offenses because it's just not, it's just, who would do that? You would think it's common sense, but it's really not. It's not common until you already know it. Okay. Good. Good. Okay. So once we have completed the skills, we're going to go into a room. We're going to take a 60-question written test on the computer. Now, if you stay reasonably awake in my class, just reasonably awake, you're not off here and there, but reasonably awake, this written test will be a no-brainer for you. No-brainer. Now, if you need a little more help, just a little more help, I have a game show that I do on every other, or the first and third Tuesday of every month. So next Tuesday, not tomorrow, but a week from tomorrow will be my next game show. And I do 15 test-like questions on YouTube. You have to go directly to YouTube for this. 15 questions. You get a question, 4 answers, just like the state exam. And you get to put into the chat the answer you want to pick. And the program that I use reads the answers as they come into YouTube and assigns points. Puts you on a leaderboard. Top 3 people get prizes, real prizes. I give away flashcards, card games, badge holders. We've given away tumblers, or like the cheat shirt. Yeah, we give away t-shirts. We give away real prizes, and we send them all over the country. People all over the country compete. But it's a great way. I've done this for several years. So if you go onto my YouTube channel, look under playlists, look at the game show, there's like years of episodes that I've done. If you go through all those, it's like almost 1,000 questions that you can practice for the state exam. You've also got homework, which we're going to get to, that will give you questions. And you know that online course we were talking about? There's over 1,000 questions in there as well. So, guys, just stay reasonably awake. I'll get you through the written test, I promise. Okay. All right. I also have this resource. Now, this is something that you are going to want to get. If you go to flcnatraining.com, I have a link. You can go directly to the link for your cna.com/ebook. You're going to get this link in your wrap-up email today. Don't worry about writing this down. It's also on the paper you got, the blue paper, first things first thing. It's on there. I've got this thing linked everywhere. Everybody can find this, right? The ebook. This is a PDF. So you download it to your device and go through it. But this tells you all the test secrets. Tells you how to read the question, figure out what they're asking, and pick the right answer. This is, I've had lots of people that failed the written test twice, not from my class, people, because remember, we're the #1 channel on you. There's people right now that are watching. By this time tomorrow, what you're seeing, this view will have over 1,000 views by this time tomorrow. Right now, I've only got, what do I have? 37 on? 37 live. So understand this is, universal. But we've had people that have contacted us that failed the written test twice, got my ebook, and then emailed us back and said, oh my gosh, this was the secret that I needed. Okay. So if you're not a good test taker, this is your first stop. This will help you be a good test taker, but it'll also help you narrow in on the topics that you need to know for the exam. Good. Okay. So I've got that for you.
This might be, I guess, a silly question, but for like the actual skills themselves, since we're going to be partnering up with someone, are they going to have us doing any type of like 2-person transfers, or
Nope.
is it going to only be single person?
Single person skills.
Okay.
Yep. Single person skills. Yep. Yeah. So this is what some of the pages of the ebook look like. If you want to see like a physical copy, because it's digital, it's an ebook, you're going to download it. But if you want to see it, I've only got one. These things are expensive to print. I've got one that I printed that's up here that you can flip through to see what it looks like. But it's free. Just download it. Easy. All right. So once you are done with the test, so we've done our skills. You went to the waiting room. You waited for everybody else to get their skills done. You went into the written test room. You took your written test. You're done. Before you hit submit, the evaluators, they're not going to let you hit submit on your own. They're going to go through and make sure that all of your questions are answered. There's no blanks. And then once they're happy with that, then they will tell you to hit submit. So once you hit submit, it submits it for grading. You will receive your grade right then for both sections. So when you leave the testing room, you are going to leave with your results. The evaluators cannot discuss any of these results with you. They are going to fold it in half. They take your results, they fold it in half, and they hand it to you as you're walking out. And they will tell you, do not open this until you're outside. They are not going to discuss anything with you. Because if you open, you go, well, wait a minute. I did this. You know, they're just not going to go down that path with you. Oh. Okay. All right. When you're done, these are the results that you're going to get. So this is what you see on the screen here. Oops. Let me go. Where's it? Oh, there it is. All right. This is the one that you see on the screen. These are the results for the written test. And I'm going to pass this around for you guys to see too. These are the results of the written test. Now, here it'll tell you you passed the written. Yay. Great job. Down here, though, this is the part you want to pay attention to. Each question is going to fit into one of 5 categories. Now, they're not going to tell you the following 7 questions are from the safety category. Then you would know how to answer them. You're going to see 60 questions. But each one of those questions is going to fit into one of these categories. So as you can see, the role of the nurse aide, you're going to have 9 questions on the role of the nurse aide. You're going to have 9 questions on safety. You're going to have 12 questions on the promotion of function and health of residents. These are the skills that we do. Bathing, dressing, grooming, feeding, right? Keeping somebody healthy. You'll have 13 questions on basic nursing care provided by the nurse aide. Now, I'm going to time out here. And I don't normally talk about this, but I keep seeing this over and over. So I need to bring this up real quick. Ethan, so where will they send my grades when I'm done with the written test? Ethan, they'll give them to you that day. That you'll get this printout that day. All right. So basic nursing care provided by the nurse aide. You have to look at the test plan to understand what questions are in each one of these categories. Now remember, I'm subject matter expert. I have spent my entire nursing career studying the test. I know more about this test than I know about my children. Okay. 13 questions. The most questions comes in this category. And you would think nursing care is bathing, dressing, grooming, all the stuff that we do, right? That's not nursing care. That's promotion of function. That's keeping somebody healthy. Basic nursing care is going to be how to handle emergencies. If somebody is choking, what do you do? If somebody is suddenly confused, what do you do? If somebody falls, what do you do? If you're walking somebody and they get woozy, what do you do? This is the biggest section of the exam, and it's all about keeping your patients safe. Now, we have a whole safety category, but that's going to involve different types of questions. That's more facility safety. Okay. This is the biggest section, and it's not what you think it is. Good. And then we've got just 7 small questions on changes in health. So this is going to be like death and dying, how to work with somebody with, congestive heart failure, diabetes, Parkinson's, that type of thing. Do you notice nowhere on there does it have anything about medical terminology, anatomy and physiology, right? Those aren't the things that we're being graded on. And that's what most people will study for the test. It's not on the test. It's how we work with patients that's going to be on the test. Most of these test questions are scenario-based. They're going to ask you, what are you going to do when? What are you going to do when? Because CNAs are doers. CNAs are not thinkers. Okay? So if you catch yourself saying, I think, you took a wrong turn. Good? You'll also get this printout. Now, this is on the skills. So they look a lot alike, right? They look a lot alike. But this is the skills. And I know it's the skills because some of the skills are listed down here. We have hand washing, and then we have measure and record pulse. Now, there's going to be another page that has the last 3 skills on it. Now, wait a minute, 3 skills. 2 plus 3 is 5, but you only told me that I was being graded on 3 skills. Well, that's not technically true. You are going to be assigned 3 skills, but you're going to be graded on 5. Now, what you're being graded on are the 3 skills on that yellow paper, the yellow sets that I sent around, and hand washing, they're not going to tell you about, because you have to know when and how to wash your hands. If I tell you, hey, go to the sink and wash your hands, I can't grade that you know when. So nobody's going to say anything about hand washing, but you're going to be graded on it. The last thing you're going to be graded on is indirect care. Remember talking about those checklists earlier? I told you that they had indirect care as a separate group. I've combined them. Indirect care on your results sheet is broken out and graded separately. Indirect care can fail you. If you miss too many things on indirect care, it can fail you. That's why it's broken out into a separate section. And then you get this page. Now, this is the most important page. You get 1 for the written, tells you you passed. You get 2 for the skills, tells you you passed. But this page is the one I really want you to pay attention to. These are all the deficiencies that you got while you were doing the skills. Remember, anything without a check mark was a deficiency? You guys remember that? These are all of your deficiencies. Now, why do I want you to pay attention to this, even if you passed? Because eventually you will be working on a real body in a real bed. And if you miss these during the test, you're probably going to miss them when you're working on real people. If I'm the real body in the bed, do you think I want you missing these? Good enough is not good enough in healthcare. Just because you passed doesn't mean there's not an opportunity for improvement. Pay attention to those. Good? Questions? Okay. So as I was going through all of these checklists a million years ago, I started noticing that checkpoint 1 was the same on every single checklist, every single one. Checkpoint 1 says, did the candidate, that's you, greet the resident, address by name, and introduce self? Right? It's all on one line. So that means that if you greeted the resident and you addressed them by name, but you didn't introduce yourself, are you going to get a check mark? No, and no check mark means a deficiency. So if it's got 3 things on it, that means you've got to do all 3 things to get credit. There is no partial credit here. Make sense? So every single skill, all 20 of them, started with the same number 1. And I thought, so if I just teach them that and have them do it at the beginning of every skill, well, we've automatically got a check mark. Pretty cool. So then I kept going. And guess what? Number 2 was the exact same for every single skill. And I thought, if I just teach them to do this, then they automatically get that check mark for every single skill. Wow, that just made this a whole lot easier. I teach them to do 2 things, and we've covered 2 check marks on every skill. Cool. Oh, but wait. This one was the same too. Don't touch the resident until your hands are clean. So if I teach my students to do that, then we get this check mark on every single skill. Cool. My job just got even easier. Wait a minute. Hold up. There's another one that's the same on every single skill. Leave the call light in or near the resident's hand at the end of this. Oh, but that's at the end, not at the beginning. The others were the beginning. So this is different. This is at the end of every skill. So I'm going to teach everybody to do this, but they're going to do the other things at the beginning and they're going to do this one at the end. So how do I separate that out? Let me think about that. Are there any more? Oh, there certainly is. Asking about comfort or preferences at the end of, oh, that's at the end again. So we're going to separate that out, put that over here. So if I teach somebody to greet the resident by name, introduce self, explain the task, and not touch the patient until their hands are clean before every skill, and I teach my students to make sure the call light is near their hand and to ask them about preferences at the end of every skill, well, then we get all of those check marks. And they only had to learn 2 things. Let's keep going. This is how the principles were developed. So everything on that back wall that we are going to learn shows up in multiple skills. They're checkpoints that are repeated over and over and over and over. And this was the first one, the opening. These are all the things that we have to do before we do a skill. And they show up on every single skill that we have to do. So we're going to learn how to do this, and we're going to do it at the beginning of every single skill, and we're going to get 7 or 8 checkpoints automatically before we even get to the skill itself.
When it says wash hands, is there like a certain time where it should be with hand sanitizer, or is
We're going to talk, yeah, we're going to talk about hand sanitizer in detail next class. Okay. And the rest of that I'm going to get at the end of today. I got to pick up my pace a little. Okay. But yes, I am going to cover that. So this is called the opening. This is what we're going to do at the beginning of every single skill we do, no matter what. Are we brushing teeth? Are we doing range of motion? Are we ambulating a patient? Are we turning a patient over in bed? Are we transferring them to a wheelchair? Are we feeding them? I don't care what the skill is. We're going to do these steps. And we're going to get all of those check marks. Good? Good. And then at the end of the skill, we're going to do a whole bunch of steps at the end of every single skill, and we're going to get all of those check marks as well. So what ends up happening, I like color. Can you tell? I like color. What ends up happening is this. These are all the checkpoints for this skill. This is range of motion. I'm sorry, this is pulse. These are all the checkpoints for pulse. Okay. Remember I said pulse was the most failed skill? You guys remember that? Okay. So all of the checkpoints. Anything with green gets checked off with the opening at the beginning of every skill. Anything with red gets checked off with the closing. The steps we're going to do at the end of every skill, we're going to do them over and over and over and over and over again, exact same way. Okay. So when you look at this, we haven't done the skill. We have not learned pulse. If all we do is the opening and the closing, I want you to look at everything that we got checked off. You guys see that? That's a lot. There's only 3 things that we didn't get checked off. So the skill itself is only giving us 3 check marks. Everything else is the opening and the closing. So this is super important. And it's not just pulse. This one. See all that red and green? All these colors that you see on here, these are principles we haven't learned yet. They're repeated principles that we're going to do over and over again. Anything white has to do with the skill itself. If you're looking at these, the things that you guys focus on, right, when you're doing these skills, the things that you guys focus on is not what's going to give you those check marks. You guys focus on the actual getting the patient out of bed and into the wheelchair, right? Lock the brakes, move the stuff, right? That's what you focus on. Yeah, that's only like 3 check marks. If you do that, but you don't do these steps, you're going to fail. So when you're practicing, we're practicing the entire skill. This is part of the skill. You get checkpoints for this. Make sense? Okay. A lot of students will practice, but they'll only practice the skill part. They don't practice this. Well, if you're not practicing this, when you get into the test and your brain goes absolutely blank, you'll forget to do this. And then you're going to fail. Good. Okay, so that's what I just showed you. This is part of what we call the Big 4. These are 4 things that are graded for every single skill that we do. Every single one are going to have these principles involved. We're going to follow the care plan. We already know this one, right? We follow the care plan, the whole care plan, and nothing but the care plan. While we're following the care plan, we should be making observations. What do we do with those observations? Report them to the nurse. You already know this. We're going to do the opening set of steps that we're about to learn that you're going to be able to recite back to me by next week. We're going to learn the closing today, which is a set of steps at the end of every skill that you're going to be able to recite back to me next week. We're also going to learn glove rules, but we're going to put this one off until Wednesday because I have a whole hour lecture that we're going to talk about with gloves. Okay, so this one we know, these 2 we have to learn. This one we'll learn on Wednesday. You see them all on page 27. And these principles are in my flashcards if you choose to get the flashcards. For you guys that are in my class, as long as you're in my class until through graduation day, they're discounted down to $14.99 for you. If you go onto my website, they're $24.99. So you guys are getting a $10 discount. You can also make your own. You can make your own. All right. So before I explain the opening steps, I want to talk just a little bit about the patient experience because these actually go together. So when we're thinking about CNA work, we tend to focus on ourselves, right? Our tasks, what we're doing, our steps, we have to remember that this doesn't have anything to do with us. We need to get so good at these skills that we don't really think about them and we can then focus on the patient. But let's talk about those patients for just a second, because those patients are probably in a different headspace than you are. Your patient is sick. If they were not sick, they would be well. Well people don't need us, right? So by you being there, your patient is impaired in some way. So we have to think about that. So impaired means dependent. They have to rely on somebody else to do things for them. When you are sick, where's the one place you want to be more than anywhere else? Home. You want to be in your own safe space. I want to be laying on my couch in control of the TV remote. Right? That's where I want to be. I want my doggy snuggling up with me. I want people to bring me what I want and then go away. Don't talk to me. I'm sick. So we're in a little bit different headspace, aren't we? Now, if somebody is not in their home, if they are in a hospital, a rehab, a nursing home. They are not in their home. Where do they want to be? Home. Absolutely. So understand that this is automatically going to make somebody grumpy, frustrated, irritated. I am not where I want to be. Absolutely. Absolutely. Now, as CNAs, if we don't understand this, we get defensive. We get frustrated right back at them. You know, I'm in a lot of CNA groups on Facebook and other social media platforms. And I saw one that I understand why they put it up. I do. I get it. I've been there. But it's not right. It was kind of a skit, a parody, you know, of a CNA walking into a patient's room. Didn't show the patient, just, Mr. Jones, how can I help you? Your call light's on. Okay, here's your water. Walks out, comes back in. Okay, what do you need now? Because your call light, I just turned it off. It's back on. And this went on like 3 or 4 times. And by the last one, they pulled the call light away from the patient, hid it from them. You've lost your call light privileges. And I get it, right? Somebody on the call light all the time is annoying. It's interrupting your work. But they're the reason that we have a job. We don't get to make that decision to remove a call light from them. If they didn't need a call light, where would they be? At home. They need help, which is why they're here and why you're here. And if they're on the call light nonstop, that means that there is a need that they have that is not being met. And it's probably not the water or the blanket that they're asking for. By taking that call light away, you are robbing them of the need that they have. Do you understand? So we have to start thinking about our patients a little bit differently. We have to understand that they don't want to be here any more than we do. We're here for a paycheck. They're here for help. Luckily, our job is to help them and we get a paycheck. That matches up perfectly. But if we start interfering with that process, it's not going to match up perfectly. And we're going to get patients that give us bad reviews. Now, why do we care about that? Well, because reimbursement is tied to reviews. When we have health care that's performed by CMS, Medicaid, Medicare, if somebody receives Medicaid or Medicare services, hospital, nursing home, wherever, they are going to fill out a survey regarding that care. If that survey gives bad marks, that payment is going to be decreased. So the hospital bills $10,000 for service. CMS asks the patient, how was the service? And the patient says, horrible. They took my call light away. CMS is going to go, you might want $10,000, but you didn't give $10,000 worth of service, so we're going to cut that down to $6,000. Here you go. So now your facility got less money based on your performance. What do you think is going to happen to your raise? So this matters. This matters. The way your patients perceive the care you provide matters. So we have to talk about it. Now, that's bad enough, right? Your patient's not home. That's where they want to be. They're not home. That's bad enough. But that's not the only problem. Because patients that are sick all think they're dying. Just ask them, they'll tell you. Right? They're concerned. They're consumed. How is this going to affect my ability to work? How is this going to affect my ability to pay this bill? Because healthcare is not free. How is this going to affect my lifelong independence? Am I going to be able to go home? Am I going to need a wheelchair? How is this going to affect my relationships? They tend to become very self-absorbed, rightfully so. Their entire life has just changed. Now, if we don't understand this, we go in and we start talking to them. We think that they hear us and they understand us, and then we leave and we get frustrated with, I just told you that. Well, they probably weren't in a position to pay real close attention when you told them that. Or they may have even been affected by medications. Now, the one thing that you need when you're sick is rest. Rest is so important. Anybody ever been a patient at a hospital? What's the worst place in the world to try to get rest? Sure. Somebody comes in on average every 17 minutes. That's the average. 17 minutes. Now, if this patient is able to somehow, by the grace of God, drift off to sleep, and subconsciously they hear a sound and their eyes pop open and they see a complete stranger standing over them with a sharp object in their hand, how well are they going to be able to go to sleep again? No, because we have to remember that in healthcare, we're not the only ones in the room. There are doctors and nurses and x-ray techs and EKG techs and phlebotomists and billing clerks and nutritionists getting the next day's menu, and people dropping off flowers and newspapers, and visitors of the roommate, and social services people and discharge planners. It's non-stop. Your patient is not going to be able to focus 100% on each one of those people. And it's pretty wrong of us to assume that they will. Make sense? So our patients are having a really bad day. They're distracted. They're self-absorbed. They're unfocused. And they probably have a pretty bad attitude because they're sleep deprived. So I'm going to tell you the maddest I ever got at a CNA, and I'm going to tell you some stories in here, but this is the maddest I ever got as a CNA, or with a CNA, is a CNA who told me, well, she started it. Well, congratulations, because I'm going to finish it. Your patient has the right to act sick. You do not. If you find that your patient is very grumpy, distracted, demanding, they need more attention from you, not less. They need more nice from you, not less. How can somebody give you nice when their bucket is empty? So we have to go into this with the right mindset. Make sense? That's important because most of what we're going to learn in the opening has to do with this. Every patient's going to be different. They're going to need different things from us. But it's up to us to understand that when your patient is grumpy or distracted or demanding or difficult, they probably need a little more understanding, not less understanding. Okay? That's what a lot of what we're going to learn is going to center around. Remember, above everything, it's always about the patient. Now, during the test, you probably will make a mistake. It's normal. You forget a step, you do something that, oh my gosh, I did that wrong. I forgot I was supposed to. You can actually make corrections during the test. It doesn't have to be perfect. It doesn't even have to be pretty. You can make corrections. And all you have to say is, correction, I would have. Okay. Now, if it's something like the order, like correction, I would have closed the curtain before I started doing my skill. You can do that verbally. If it's an action, usually they'll tell you, well, I need to see that. Like I can't say, correction, I would have brushed his teeth. It's like the whole skill, right? So make corrections verbally. The evaluators will tell you what they need you to demonstrate. But if it's an action, you're going to have to demonstrate it after you say correction. Good? If it's order things, we can correct it verbally. But corrections can actually save you. Got a whole lesson on this, page 33. There's a video for it. But a correction gives you that check mark. Remember when you do something right, you get that check mark? Anything without a check mark is a deficiency. So if you make a correction and you get a check mark, it's no longer a deficiency. It doesn't count against you. The paper doesn't know whether you did it or corrected it. The paper doesn't care. It's a check mark. We all start at 100. Your deficiencies decrease from there. So check mark gets rid of your deficiencies. It's good. Good? All you have to say is correction. All right. Yeah, we know that. Okay, so let's get to our books. You have two books. This one is the one we've been working out of, the spiral book. That's yours. You write in it. You can color it. You can eBay it. You can burn it. I don't care what you do with it. It's yours. This one is not. You're going to take this one home with you and leave it there, the yellow book. The yellow book is your homework reading book. I don't like the yellow book, but it does have its merits. Okay, it's going to cover some stuff I'm not going to cover in class. Every place has homework. This is no exception. It's going to give you kind of some background information that you need. But remember, care plan is king, right? It doesn't cover the care plan as well as I like it to. The other thing is that you're going to notice some discrepancies between the way they tell you to do skills in the yellow book and the way I'm showing you to do skills. If there's a discrepancy, always go by me. I am Florida based. Okay. That book is used nationwide, so it's very generic. What we're learning for skills here is based on your test. So if there's a discrepancy, who do you go by? Me. Okay. And then we've got the syllabus. Now, the syllabus is going to be our roadmap. This tells us how we're going to get from where we are until the end in a logical, organized manner. When you're looking at the syllabus, each row going across each section is a day. So you can see that very first section that's got a big heavy box around it is all today. This is what we're going to go over today. Now, the first column are going to be the skills. Now, we still have a long way to go. If you look there, you'll see that, well, we've covered skill rules, right? We follow the whole care plan in. Okay. While we're doing that, we're going to make, and we're going to report them to, okay, so we know that. But we don't know the opening, the closing, hand washing, or indirect care yet. We still have a ways to go, and I've only got 45 minutes. Okay. The second column are the lectures that I'm going to give during that class. Now, we have made some progress there. We learned about what to expect on the test. We learned about delegation and liability. We learned about the patient considerations. We learned about testing care plans, and we learned about the principles. So we've got all of those checked off. So this hasn't been a complete. The third column is your dreaded homework. You're going to go home and read chapter 1 in the yellow book. But just reading isn't going to help you. You really need to figure out, did you get what you needed to get from the reading? So in my white book, I created a little test for you to be able to gauge, did I get what I needed to get? So you're going to go home and read chapter 1 in the yellow book, and then you're going to take the test on page 181 in the white book. The very last page in the white book, page 201, has your answer key, so you can grade it. And anything that you missed, you might want to go back to your reading and brush up on it. I don't care about grades. Couldn't care less about grades. If I'm the patient in the bed, I'm not going to look up and say, what's your name? Jamie. I'm not going to look up and say, hey, Jamie, what'd you get on chapter 4? Do I care as a patient what you got on chapter 4? No, I'm hoping that you learned enough about chapter 4 that if I start having difficulty breathing, you're going to know what to do. Okay. So for me, grades mean nothing. Comprehension means everything. And since this is an adult class, you're responsible for your own comprehension. So do the reading, take the test, and grade it. Anything that you missed, go back and brush up on. Fair? Now, the last column are things I'm hoping to get to in class, but I may not, depending on time. So anything in that last column, if it doesn't look familiar to you, you need to read that lesson in the book. Now, we did talk already about the 5 key phrases. Remember the house, the CNA Happy Place we talked about? So we've covered that. We covered the care plan activity. We did that like an hour and a half ago. Corrections we've learned about. Now we still have to learn about warm, dark, moist, and we did learn about skills grading already. So out of that, there's only one lesson you may have to go back and read. Good? If you keep this with you as we're going through our lessons and you just kind of check off the ones that we go through, it'll give you a sense of accomplishment. Because if you checked off everything that we've already covered in this, as we were covering it, when you leave here today, you're going to look at that and go, wow, look how much I've learned already. Okay. Keeps you from getting quite so overwhelmed. So we do that for every single class. And I do stick to this pretty religiously, except next class, you'll see range of motion shoulder at the very bottom of class 2. Sometimes I have to, or I should say most of the time, I have to push that down to class 7 because there's so much I have to tell you. Now, we're going to see if I can get my act together and maybe not talk quite as much as I usually do on class 4, or I'm sorry, class 2, so that we can get all of those skills done. I'm making an effort. We'll see. All right, so the yellow book is just for homework reading. Please don't write in it. Don't highlight it. You're going to return it to me on the very last day of class.
Is there any way we could buy one of those books?
You can, but my suggestion is to buy it off of Amazon.
Okay.
Don't buy it from me because I have to charge you more than what Amazon would.
Okay.
Okay, so just get the ISBN number off the back, go on to Amazon, and order it from there.
We also have the affiliate link to it. On
Yeah,
the
if you...
Livestream.
Yeah, thank you, Jake. If you go to flcnatraining.com, you'll see a picture of the book. If you click on that picture or, that link, or in the description of the live stream, if you click on that, I do get a very small affiliate compensation for that, for pushing you over to buy it there. Because that's not me. I'm not selling it there. I'm just pushing you there. So you can buy it there. But I'm going to tell you that once you do the reading, you'll never look at this book again. Yeah. All right. Yeah, we just went over all that. Again, I keep forgetting how to press buttons. All right, so let's learn how to use the main book, the spiral book. This one, the CNA Skills Study Guide. This is the one we're going to work out of in class. You need to bring this book with you for every class. But I'm going to show you how to use this. Thank you, Jake. This is the overview of the skill. So for every skill, we're going to have an overview page like this that kind of gives a quick bird's eye view. And then the next page will be your specific, getting into the nitty gritty, the details. So first page is overview. Second page is details for every skill that we're going to learn. While we're learning, details are going to be important. But after learning, for review, overview is where it's at. Okay, good. All right. So when you're looking at this page, this is Pulse, which we're going to learn in an upcoming lesson. The title is going to be at the top of the page. You're going to have our principles down the side. So this is kind of a quick glance at the principles. So this particular skill We're going to follow the care plan. That's skills rules. We're going to do our opening because we do the opening for every single skill that we do. We're going to evaluate if we need gloves. We might not. I don't know. We're going to see if we need gloves, and that's going to be on Wednesday. We'll have that whole lesson. And we're going to do our closing, which are steps we do at the end of every skill. Okay, so those principles are all written out for us here. So it just shows us the principles involved, but they're all going to be expanded for us here so you can look at them. Page 52. So we've got our details here. Okay. Now we also, for every skill, because remember, these are our steps that are going to be repeated skill after skill after skill after skill after skill after skill, right? But you're also going to have a few steps that are just specific to this one skill. We call those skill specific. That's here. So if you follow the care plan, do your opening, figure out if you need gloves, follow these steps, and do your closing, you will get everything checked off. Now, you might be wondering, well, what are these steps? They're here. This will tell you how to get these checked off. This is your short form of the skill, kind of your cliff notes. So let me give you a good example of this. How many of you guys have made a peanut butter and jelly sandwich? Okay. How many steps are involved in a peanut butter and jelly?
3.
Okay, 3, 5. Any other guesses?
If you consider taking it out of the package as one, then maybe 6.
Okay, 6. All right. It's actually 42. Yeah. I mean, real. I'm not making it. We're not doing anything crazy. We're not going to toast the bread, cut off the crust. We're not going to do anything crazy, but let's go through it real quick. Right? Let me prove it to you. So what do we need to make peanut butter and jelly? Let's start there. So let's start with the bread. So the bread has that little twist tie thing on it. You got to undo the twist tie to open the wrapper to get a couple pieces of bread out. And then you got to do the whole spinny thing and put your twist tie back on and put it back on the counter. I'm holding 2 pieces of bread. Where do I want to put it? Oh, I don't have one of those. So I have to open the cabinet, get a plate, close the cabinet, put the plate on the counter, put the bread on the plate. Now what do I need? Peanut butter. That's in a pantry or a cabinet, right? So I got to open the cabinet, get the peanut butter, close the cabinet, put that on the counter. Now what do I need? Jelly. That's in the fridge. So I got to open the fridge, hunt, find it, get the jelly, close the fridge, put that on the counter. Now what do I need? A knife. So I got to open the drawer and get a knife and close that drawer. So now I got a knife, I got peanut butter, I got jelly, I got bread, and I got a plate. Good job. But we can't get anything out of those jars because they're covered with lids. So we've got to unscrew the lid of the peanut butter, put it on the counter, unscrew the lid of the jelly, and put it on the counter. I'm going to pick up my knife, scoop out some peanut butter, spread it on the bread, wipe it off on the other slice of the bread before we get our jelly. We'll get some jelly, spread it on our bread, and put the knife in the sink. Don't leave it on the counter. Mom will yell. We're going to pick up our lid, put it back on the peanut butter, pick up the other lid, put it back on the jelly. Open the fridge, put the jelly back, close the fridge. Open the pantry, put the peanut butter back, close the pantry. Put our bread together, and now we can eat. Did I make anything up? So why did you think it was only 3 or 5 steps? Okay, so once you've done it a few times, we now don't have to think about all those little steps. We can just think peanut butter, jelly, bread, eat, right? That's what this is. This assumes you've made a peanut butter and jelly before. This reminds you of the big steps. But if you're just learning, this is going to leave out a lot of things. We need our 42-step peanut butter and jelly to learn with. So on page 53 is where you're going to find your 42-step peanut butter and jelly. Now, if I can be that detailed with peanut butter and jelly, just imagine what I can do with partial bed bath. Okay? But I bring this up for a very specific reason. Peanut butter and jelly is not hard. A 5-year-old can make a peanut butter and jelly sandwich. Probably make a mess, but they could make a peanut butter and jelly sandwich. It's not a hard thing to do, but there's still a lot of steps involved, 42 steps. Everything that we're going to learn in this class is theoretically easier than a peanut butter and jelly. Not to you at first because you haven't done it yet. It's going to seem big at first, but over time, when you practice it, there's fewer steps than in a peanut butter and jelly. Okay, good, good. All right, so going back to page 52, we have our principles down the side that tells us kind of our starting point. They're all spelled out for us here, and every skill is going to follow this pattern. You're going to have your 3 or 4 step peanut butter and jelly, your quick reference is what we call that, and your skill specific steps. So remember, this is an overview of your skill. I always provide the name of the video. I always have a video. Always have a video for everything we do. And then at the bottom, we've got some test specific information. So this is all about the test. This has nothing to do with real life. This is all about the test. So it's going to tell us how long the test thinks somebody with your level of ability should have to do this skill. Not my level of ability. I've been doing this for 35, 37 years. I can do this stuff in my sleep quickly. I've got lots of practice. You are brand new. You're not going to do anything quick. And you're probably not even going to do it pretty. And that's okay because you're new. You're right where you're supposed to be. Don't compare you to me. That's unfair. Compare you to other yous. Sloppy still gets the job done. You're okay. You'll get better with practice. Okay? But somebody with your level of experience should be able to count a pulse in 5 minutes. If you remember the care plan, it told us to count for 1. And they're giving us 5. Okay? They overestimate the amount of time you need. You're going to be doing this on a live testing student. So that means somebody like you. Go back here. Let me go back real quick. So remember that timing that we talked about when we had our care plan sets on page 25? It has a time at the top. Well, this is what they use, one of the things they use to determine this time. We'll go over the formula that they use a little bit later, but they take the time of all 3 skills, add in 3 minutes for hand washing and 5 minutes for thinking, put it all together, and that's how we get that. So give you lots of extra time. Okay. I have a whole lesson on that on page 71 if you want to, go ahead for those of you who absolutely need to know. All right. So the second space there will tell you whether this is going to be done on a live testing student like you, or if we're going to do this on a mannequin, because there are some skills that we're going to do on mannequins to be specific. So if you see a mannequin in this space, like this one is dressing a resident with a weak arm, we're going to do that on a mannequin. So if you see a mannequin on this page, that means when you're practicing, you really should practice on the mannequin so you get a feel of how it's going to work for the test. Okay, everything else is done on a live person. The next space will tell us whether that person is going to be in a chair or a bed. If we're going to be doing mouth care, the person's going to be in the bed. If we're doing denture care, our care plan is going to tell us our person's in a chair. Now, you want to set this up as a dress rehearsal for the test. You need to know, where is my person going to be during the test so I can practice that way? I'm giving you that here. And then the last icon there will tell you whether documentation is required. Guys, remember I said there's 4 documentation skills? So 4 of those are going to have a clipboard. If there's a clipboard, usually, these are our 4 documentation skills: pulse, feeding, respirations, and drainage bag. If there is a documentation component to our skill, let me go back here. If there's a documentation and there's normal values, it's going to be located right next to it. So like going back to page 52, we have to document pulse. Normal is between 60 and 100, and you can be off by 4 beats in either direction. So it tells you your variance to be considered accurate on the test. Okay, so that was the overview page. Page 52 is our overview page. Now let's get into our specifics. So page 53 is our learning page. So page 52 is more like a review or an introduction. Page 53 is how we're going to get into the nitty-gritty. So how do we know what to do with each patient? We have to have a care plan. Absolutely. We have to have a care plan. So at the top of the page, everything starts with a care plan. That is our care plan for this skill. And this is the actual testing care plan. So we're always going to read the care plan first, no matter what. Even if we think we know how to take a pulse, we're going to read the care plan. So this care plan tells us patient will be lying in bed for skill, take the patient's radial pulse, measured at the wrist for 1 full minute, and record your readings. That's what we're told to do. How are we going to do that? Well, we're going to follow these step-by-step instructions. Exactly. At the bottom of the page is going to be your supplies that we need to do that particular skill. For this skill, we need a clock, which will be on the wall above the bed. We need a pen and a documentation form, which they're going to give us at the beginning of the skill. Step-by-step instructions will tell us how to do that. This is just for your knowledge. You don't have to write this down or anything, but page 37 has all of the supplies, like a picture of all the supplies. So if you don't know what a bath blanket is, look on page 37, it'll tell you what a bath blanket is. Everything in healthcare seems to have 2 names. I don't know why. No idea why. But in general, I have put both names on these supplies so that you would know. Okay? Now, these step-by-step instructions in the middle of the page are details. This is our 42-step peanut butter and jelly. Like, you didn't even think about the twist tie on the bread wrapper. I'm very detailed. I'm not going to miss anything. I'm going to tell you exactly when to take the toothpaste cap off the toothpaste. It's that detailed. You are not going to have to think about anything. You're just going to follow these steps, because these steps were written using those checkpoints. And I'm going to make sure that you get every single one of those checkpoints checked off with these steps. Good? All right. Every lesson that I have in this book has some review questions after we do the learning. If you can review and complete these and get them right, the answer key is in the back of the book. If you can get these right, you now have the information you need to be successful. So it's kind of a self-check. Good? Am I going too fast for anybody? All right, you guys have all been enrolled in the online course. You got an invitation in your email that said, congratulations, you've been enrolled. We did this yesterday. You can just sign in. Just go to courses.foryourcna.com. You're going to sign in with your username and password that you probably created when you did our enrolled in the class. Your email is, you can use your email instead of a username too, by the way. If you can't remember what you created as a username, just put your email in there and then whatever password you used. Everything that I'm saying, I have a lesson for. So if this felt like it went a little fast, this is going to be your friend, because this is going to slow it down and put you into the learning. It makes you do activities to make sure you've got it. All right, so the big 4. We know skill rules. We follow the care plan, the whole care plan, and nothing but the care plan. We make observations or report them to the nurse. Now, let's learn the opening. This is going to be on page 31. This is going to be done at the beginning of every single skill we do. Everyone. The opening has very specific steps, and they have to be done in a very specific order. You can't play around with this. Has to be done in order. So we've read our care plan because that's always step one. Step one is always reading the care plan. Always, always, always. But once we've read the care plan and we're ready to get started, what do we do? Where do we start? And this is where most people freeze on the test. Because you've got to be able to start. And if you don't know where to start, you tend to freeze. So we need something to help us not freeze. So the thing that we're going to use is every skill starts with the opening. So I know I have to do this at the beginning of every skill. But every opening starts with a knock. Now, once you get to that knock, the rest of it will flow. But we have to have a way to start because otherwise you'll just freeze and you won't know where to start or what to do. So every skill starts with the opening and every opening starts with a knock. Now, this is, I don't care where you are. I don't care how many times you've been in the room. When you are entering a patient's space, that has to be their safe space. You have to knock. You have to announce yourself in some way. You don't just barge into a space. I know that they're temporary. They're patients. That is not your space, though. That is theirs. They have paid for it. Trust me, they're paying for it. They have the right to privacy. So we have to knock. We have to announce ourselves in some way before we walk in. This is one of the highest scoring checkpoints on the test. That's how important it is. So we have to knock. Every skill starts with an opening. Every opening starts with a knock. Now, once we've knocked, we don't have to wait for a come in or anything like that for the test. You just knock. It's a courtesy. But in a clinical setting, if that door is closed, I'm not barging in. I don't know what they're doing on the other side of that door. And there are some things that you cannot unsee. So knock and wait. If you don't hear anything, knock again. If you don't hear anything, crack the door. Hey, it's Patty, the CNA. Can I come in? But don't just barge in thinking that you own the place. Okay. Now, this is what our opening sounds like. Good morning, Miss Jones. My name is Patty. I'm your CNA today, and I'm here to whatever. Is that okay? I'm going to close the curtain, wash my hands, get my supplies. I'll be right back. That's our opening. And we're going to do it over and over and over again. It never changes, ever. Never changes. So, hi, Miss Jones. My name is Patty. I'm your CNA today. I like to throw a how are you in. I want to know how my patient is. I'm here to insert name of skill here. Is that okay? I'm going to close your curtain, go wash my hands, get my supplies. Okay. Now, it has to be done in that order for a specific reason. Let's get into that. So every skill starts with the opening. Every opening starts with a knock. Graded checkpoint. And then we're going to greet our resident. So good morning, good afternoon, hello, nice. We're nice. We're happy. We're joyful. We're bringing sunshine into a dark place, not hey. Your patient's nice bucket is empty. It's up to you to refill it. So good morning, good afternoon, hi, nice. Once I've got my greeting out of the way, I need to identify my patient. And by the way, that is a graded checkpoint. I need to identify my patient by name. This is a graded checkpoint by name. Now for the test, we're just going to use Mr. and Mrs. Jones. We use one name, takes care of everybody. Mr. and Mrs. Jones, easy, easy, easy. In a clinical setting, find their name and use it, please. But we don't use an ID band for the test. ID bands can be wrong. The best way to identify a person is by their name. Because you're Melissa, correct? Okay, this is Melissa. Say hi, Melissa.
Hi, Melissa.
If I walked in and I said, hi, Tiffany, how are you today? What are you going to tell me? I'm not Tiffany, because you do not want what I have in store for Tiffany, do you? Okay, we're not giving out tax-free lottery checks here. We're giving out colonoscopies, right? You don't want to sign up for that unless you need one, right? So the best source of identification for a patient is them. ID bands can be wrong. That's why we always greet somebody by name. Now, in a clinical setting, you're going to go by your facilities, policies, and procedures. Your facility will tell you how to identify your patient according to what they want for liability. Good? Okay. So, good morning, Mr. Jones. How are you? I like how are you. I always ask patients how they are, because if I have to get this patient up and walk them somewhere, I want to know now if that's not going to happen. I don't want to wait till I get through my whole opening, wash my hands, and then sit him up on the side of the bed and he goes, yeah, I'm not feeling so good. That's a whole lot of time I've just wasted. So I like to know, how are you feeling? Oh, I don't feel so good. Oh, let me go get the nurse. Remember, I don't do problems. I'm going to go find you a nurse. They do problems. Okay. Good. So, hi, Mr. Jones. This is a graded checkpoint. I'm also going to tell them, or where did I go? Oh, yeah, I also need to tell them who I am. Now, you don't just want to walk in and say, hey, I'm Patty. So, are you Patty the person with the cookies? Or are you Patty the person with the needle? Because I'm going to greet those two people a little different, right? So I'm Patty, your CNA today. It sets up an expectation of your role in their life. So make sure you tell them both your name and title. Once you've done that, that is a graded checkpoint. Once you've done all of that, you need to describe the skill that you are going to do. Now, you can put it in your own words. I'm here to do some exercises. I'm here to take you for a walk. Are you hungry? Would you like a snack? You can put it in your own words. But for the test, if you're a little nervous and you can't remember, your brain just isn't engaged yet, you can pick up that care plan. Remember that yellow care plan? And you can say, hi, I'm here to perform range of motion to your right shoulder. Perfectly okay. This is a graded checkpoint. Patients have the right to say no to any skill at any time for any reason. What do we do if they say no? Yeah, let the nurse know. I would probably find out why they're saying no. Nicely. But you're going to have to let the nurse know. And when you come to me and you say, hey, the patient doesn't want to whatever, I'm going to say, why? Now, if you've already got that information, that will help me. Oh, they're dizzy, they're nauseous, they don't feel well, their family's coming to visit, they don't like me. I don't know.
What if it's someone with, say, dementia or Alzheimer's, and you know they're like more
Okay.
against like brushing their teeth? Would you kind of work with them because you know that, or do you still just go get the nurse?
Dementia is a totally different beast. You have to be trained to work with dementia patients, and it's going to depend on your facility policy. I can't say that today for some reason. Policy and procedure, how they want it handled, but also the nurse that you're working with. So you're going to take your cues from them. We also treat every patient as an individual. So what works for Henry may not work for Fred. So we're going to look at that on a little bit more individual basis. For the test, they're not going to throw any of that at you because she's your patient. Generic. We're also going to get the patient's consent. Is that okay? This is a very powerful question, and it makes your patient a partner in what you're doing. Do not assume your patient is okay with you touching them. You are a stranger. You are a complete stranger. It is a checkpoint. We're going to close the privacy curtain. Now for the test, thank you, Jake. For the test, this is our privacy curtain. Notice it does not go all the way around the bed because you're being tested and we have to see what you're doing. So privacy curtains for the test are demonstrational only. They're not going to go all the way around the bed. It may just be a shower curtain on a pole against a wall. They'll show you what their what their privacy curtain is. Okay. So in here, it's just a short privacy curtain that kind of stands in for privacy. But we still have to see what you're doing. And you don't want that evaluator like right over you while you're testing. Talk about being nervous, right? We want them on the wall across the room, just kind of hanging out. Okay. This is a graded checkpoint. After we've washed our after we've closed the curtain, we're going to wash our hands because these curtains are not clean. That curtain has been touched by every pair of hands. Patients, families, visitors, staff members. It is not clean, not even close to being clean. It probably has every body fluid on it. Don't think too close about that. Housekeeping does spray it with a disinfectant spray, but it only gets taken down and laundered once a year on average. These are not clean. So if you touch this curtain, what do you think you want to do? Wash your hands. Those two things should be tied in your brain now. If you touch the curtain, you must wash your hands. Good? Okay, that is a graded checkpoint. Once we've washed our hands, we can go get our supplies. You cannot get your supplies before you get consent. It's very presumptuous. If I walk into a room with supplies to do a partial bed bath, it kind of negates the patient's consent. It assumes the patient's going to agree. So we don't get supplies before consent, and we don't get supplies before we wash our hands. Those supplies are going to be used on the patient. We're going to talk about infections, infection control next class, and this is going to be super important. Okay, so close curtain, wash hands, and then get our supplies. It has to be done in that order.
Get the consent first, right? And then get our supplies.
Consent, curtain, clean hands, and then supplies. Has to be done in that order. So your opening sounds like this. Hi, Miss Jones. My name is Patty. I'm your CNA today. How are you? I'm here to insert name of skill here. Is that okay? I'm going to close your curtain, wash my hands, get my supplies. Always in that order. Okay? Our cardinal rule here is that we do not touch that patient until our hands are clean. Ever. Ever. We're going to find out why on Wednesday, so stay tuned. All right, so I told you about the online course. Let me show you how this gets interactive. So we have a video in that online course for the opening. This is the lesson for the opening. And then below that video, we have this. This is a sequencing activity. So we're going to do this in class together really quickly. And it has 8 steps there for the opening. So the very first step, we have to pick. Now, when you're doing this on your screen, whatever screen you're using, you want to press and hold the words, not the picture. Press and hold the words, and then you drag it to the position it needs to be in. So what is, out of all of this, what is step 1? Yeah, how do we know what to do with each patient? Read the care plan. So care plan is actually step 1. Yep. Now what do we want to do? Knock. Very good. Okay. Now what do we want to do?
Identify patient by name.
Okay, we want to identify the patient by name. Now what do you want to do? Say your name. Whoop, nope, sorry. Wrong button. Say your name and title. Now
Explain the task.
explain task and close privacy curtain and
Gather supplies.
Okay, so let's see if we got this right. We're going to hit the check button at the bottom. And when we hit that, if we get a gold star, we got it right. Now, if we don't get a gold star, if we don't get green checks on all of these, some of them will be outlined in red with a red X. That means that that is in the wrong place. Down here, you'll have a retry button. When you hit retry, it doesn't keep everything that you got right in the right place. It scrambles everything and you get to try it all again. This makes sure that you truly know the order, that you didn't just guess and get lucky. Every skill that we learn has a sequencing activity like this for the skills themselves. So you truly learn the order of the steps. Okay? So that's the opening. We're going to knock, greet the resident, identify them by name, identify ourselves by name and title, explain the task, get consent, close curtain, wash hands, get supplies. That is our opening. So now let's learn the closing. I know, guys, I'm super close on time, but I think we're going to make it. All right, so now let's learn the closing. The closing is going to be done at the end of every single skill. And like the opening, these all represent checkpoints that must be performed. Page 35 has all of the steps. It also, in bold down here, it has the words. So just follow along with that. But your closing can be kind of summed up in these 8 C's. You want to make sure your patient's in a clean and safe environment. So that means take a look around. Always leave your patient looking better than you found them. That's a great principle. Look around. Make sure everything is cleaned up. Make sure the bed is in the low position. We'll talk about that a little bit later, but beds need to be in the low position. That's what makes it safe. These are all checkpoints. I'm going through this a little bit quick, guys. We want to ask if they're comfortable. The test actually needs to hear this word. Are you comfortable? But comfort's not just physical comfort. Comfort's also emotional comfort. Can you imagine, like, if I gave you guys, a 1-minute break right now, you would all pick up your phone, right? We like distraction. You wouldn't just stand there and stare at a wall, right? You need to be entertained. You need to be distracted. Your patients are no different. So we're going to offer something for distraction. For the test, we just make it easy. We offer them a magazine. Just one thing for the test. But it could be the TV remote, a crossword puzzle book. Do you have your phone charger? Just understand that a body is more than just a physical body. It also has a mind. And that has to be comfortable as well. So we're going to ask if they're comfortable and address preferences. These are all checkpoints. We're going to make sure they're covered. I do not want to see their knobby knees. We're going to hear more about knobby knees later in the program, but I do not want to see knobby knees. Knobby knees need to be covered with a sheet, a blanket, or clothes. I should not see them. So make sure your patient is covered. That is a graded checkpoint. We're going to open the curtain. Now, sometimes your patients will ask for the curtain to stay closed. That's an observation. What do we do with that? Report it to the nurse. Absolutely. But for the test, your patient is not going to ask that because the patient has a script that they're going to follow. So we are going to open the curtain because it helps prevent feelings of isolation. Helps with healing, believe it or not, seeing other humans. That is a graded checkpoint. We're going to give them their call light. They have to have a way of contacting us once we leave the room. We're going to give them the call light. But some of you are like, well, hold up. You just touched that curtain, and I know that curtain is really unclean. And now you're touching a call light you're handing to the patient. What's up with that? You think that curtain's unclean? That patient in bed is going to scratch what itches, and then they're going to hit the call light to tell you about it. That call light is just as unclean as that curtain. It doesn't matter. But patients' cooties are all theirs. It's okay. It's okay. Patients can come into contact with their own cooties without any problem. I do not want to take this patient's cooties, however, to any other patient. So how do I get rid of the patient's cooties that are on my hands? Washing hands. So I'm going to go wash my hands. We have to end the skill with clean hands. So I'm going to clean off the patient's cooties. But if I have to document, remember we have 4 documentation skills that we're going to learn. If I have to document, I need clean hands. I don't want patient's cooties on my pen. That goes home with me at the end of the day. So I'm going to clean my hands before I document. But our principle is to end skill with clean hands. So if I document, what do I need to do again? Wash our hands again. Any questions on that? So our closing sounds like this. Thank you very much, Mr. Jones. Is there anything else I can get for you while I'm here? Are you comfortable? Your environment is clean. Bed is in the low position. Here's your call light. And I'm physically going to put the call light on the bed next to their hand or hand it to them. Sorry, I just blanked there. Thank you very much, Mr. Jones. Is there anything else I can get for you? Are you comfortable? Would you like a magazine before I go? Bed is in the low position. Environment is clean. Here's your call light. I'm going to open the curtain, clean my hands, chart if necessary, and clean my hands again. That is the closing. It is twice as long as the opening, but it also has twice as many checkpoints. So if we don't do the closing at the end, you're missing out on about 8 different checkpoints. Okay. Questions? I might keep you just a few minutes late, guys. Bear with me. All right. So you want to end a skill with a patient that feels feels cared about as well. So be nice about it. All right, let's talk about hand washing, page 44. I know I've got 3 minutes. Step-by-step instructions to tell you how to wash your hands are located on page 45. But pathogens need a very specific space to thrive: warm, dark, and moist. Bathrooms are the ideal breeding environment. They're often dark because we turn the light off. They're often warm because we don't like to be chilled when we get out of the shower. And they're moist because we fling water around everywhere. So when we are washing our hands, we lather, we scrub all surfaces for at least 20 seconds. We go down our nails with our thumb to clean our cuticles. And then we circle our nails on the palm of our hand to clean under the nails. And then we rinse. After we rinse, we don't shake. We tap. Tapping keeps the water confined in the sink. Shaking puts water everywhere. So we want to tap to keep the water confined. And then we're going to dry our hands. I don't care how many paper towels you use. Use 2, use 3, use 7. I don't care. Nobody else does either. Just dry your hands, but only dry what's clean. Don't go up here. You didn't clean up here. So if you go up here and then back down here, what did you do? Yeah, absolutely. So we're only going to dry what's clean, and then we're going to throw those paper towels away, but your water is still running. And it's still running because we can't touch that faucet with clean hands. That faucet is not clean. So no, we're not going to use our elbow. We're going to get a dry, clean paper towel to turn that faucet off. Dry paper towels. Wet paper towels tend to rip. And we can recontaminate our hands and not even realize it and take that contamination over to our patients if we're not careful. So we dry our hands, throw it away, clean dry paper towel to turn the faucet off. Good? Okay, let me show you this video. It literally takes 1.5 minutes. I know I'm keeping you a little bit late and I'm sorry, but Jacob, can you put on a hand washing video, please? Okay. As I approach the sink, I can touch the faucet with my unclean hands because the faucet is not clean. I'm going to turn the water on to a comfortable temperature and wet my hands thoroughly. You must rub with friction for at least 20 seconds. I'll get enough soap to produce a nice rich lather and bring my hands together to start timing. I'm going to rub the tops of my wrists on both sides, the back of my hands, interlacing my fingers, in between my thumb and index finger, making sure that I cover all areas with sufficient friction. The bottom of my hand by my pinky and the palm of my hand. After cleaning my hands, I'm going to go down my fingers with my thumb to clean the cuticles. I'm going to circle my nails on the palm of my hand and then rinse. Being careful not to touch the faucet or the inside of the sink. After rinsing, I'll tap to keep the water confined in the sink and then dry my hands thoroughly with paper towels, being careful not to touch the unwashed portion of my lower arms. I'll throw those away and get a clean dry paper towel to turn the faucet off because wet paper towels may rip and contaminate your hands. Okay. All right, so let's, I'm not going to do that. So close, so close. All right, so to review your homework for tonight, you're going to read chapter 1 in your yellow book. You're going to take the test on page 181 of the white book and grade it using the answer key on the last page. When you come back to class on Wednesday, I'm going to go down my list and I'm going to ask you, how did you do on chapter 1? How many did you miss? There's a key or a grading scale there. It'll tell you if you missed 1, you got a 95. If you missed 2, you got a 90 and so forth. They're all worth 5 points apiece. So you can tell me I got a 95 or I missed 1. Either way, and I'll do the conversion. Now, real quick before you guys go, 2 seconds. When I call your name, there is a number on the front of your yellow book. I need that number, please. It'll say Y something on the front of your yellow book.
There are 2, I believe, that do not have a number at this time.
Okay, that's fine. Kayla.
Y7.
Felicity. Felicity.
Y1.
Jamie.
Y14.
Peyton.
I don't have one on mine.
Okay. All right. Candace. Gloria. Kinley.
Y9.
Zarina.
Y17.
Melissa.
Y3.
Y3. Thank you. Tasha. Nancy.
Y4.
Jasmine.
Y2.
Jose.
Y6.
Alani. 20. Amelia.
Y13.
Thank you. All right. You need to practice the opening and the closing. Remember, the instructions are in your book. Just open to that page, read it out loud. But the bathroom is the best place to do this. You got a door to knock on, you got a shower curtain to close, and you got a sink to wash your hands, and you got a person to talk to, the one in the mirror. Okay. I will see you in class on Wednesday. Please remember, we don't open until about 10 minutes before class starts. If I went too fast for anybody, if anybody is lost, please see me after class. Those of you that are joining virtual, thank you so much for joining. I know I'm running late. I'm so sorry. We'll see you in class again on Wednesday. Remember the game show coming up next Tuesday. Until next time, happy caregiving. Bye. Thank you.